Sorry about that. We had a technical difficulty. As I was saying, the purpose of our NCAS oral submission today is to share evidence about how the bill affects public health and it is important to note that NCAS continues to support the proposed tobacco control bill. But it plays a huge role in promoting and supporting comprehensive Sorry about that again, we have technical issues. So NCAS plays a huge role in promoting and supporting comprehensive evidence-based tobacco control laws in line with the World Health Organization. By raising awareness about the addictive and harmful nature of tobacco, our core three pillars are education, cessation support, and policy. The use of behavioral therapy is what we use to provide cessation support to through the national code line number. NCAS is part of a consortium called Protect Awareness, which constitutes of 5 CSOs. As you can see, Cancer, SAMRC, Z5, ATOM, Heart and Stroke, TC, Alliance, and REB. And our funders are the National Department of Health, CTFK, STOP, and ARTCA, which all align with the WHO guideline regarding the mission and the mandate. It is important to highlight that South Africa does have tobacco and e-cigarette research, and these are the studies that are conducted by our very own South African universities, public health institutions, and independent researchers. Screenshots as provided here have citations that provide the depth quality of research, which is home ground.
Lungile.
Yes, Chair?
Lungile.
Yes,
hello.
Chair.
May I disturb you? I'm sorry to do this to you. There is a presentation that is supposed to come after you. While we are starting this meeting, that presenter is saying they want a rescheduling. Fortunately, I've just outlined to the program that we are next week, so there's no rescheduling. If they can't meet, we probably will then have 4 today and maybe have 5 some other day next week, if that is possible for Ms. Machalamba, but there's no rescheduling. Therefore, I'm preparing that after presentation number 1, which is now going on. Can we please get the presenter that some of them are logged in here as number 3 to prepare themselves to come into the slot where it was supposed to be number 2. While we are rescheduling that request that has come in so late, it can only be rescheduled to next week and not more. If they can't make it next week, we are closed. So can I request, sorry to disturb that, presenter number 3, please prepare yourself to come in as a presenter number 2 in the absence of presenter number 2 for today. Thank you very much. Continue, Lungile.
Okay, thank you, Chair. So as I was saying on the previous slide, that we do have research that highlights what has been done in South Africa, which is tobacco and e-cigarette research. And these studies are conducted by our very own South African universities, public health institutions, and independent researchers. Screenshots and citations as provided show the depth and quality of the research that has been done, which also shows that it is home ground, evidence-based, and ready to inform policy. I'd also like to emphasize to you, Chair, that what is needed now is not more research, but political will to act on the evidence we already have. For anyone who is interested in understanding why NCAS advocates for tobacco control, it is simply because tobacco control is not about restricting one's freedom, but it is about protecting public health and reducing tobacco-related diseases which lead to the high death rates in South Africa. It is also important to remember that the core reason for tobacco control is that it is not just a lifestyle issue, it is a public health emergency for many of us, as we do know that. Next slide, please. Regarding the health and economic burden of tobacco use in South Africa, at NCAS we noted that tobacco is a net loss for South Africa, socially and economically. The revenue from the tobacco taxes is far overweighed by massive, The revenue in South Africa is far overweighted by massive healthcare costs, productivity loss, and premature death as it causes. And with this, we see that the economic drain robs the country of opportunities to invest in housing, education, and child welfare. As you can see here, honorable members, we have a slide image which captures a show called House of Zida, which was aired on ETV during family time, 7 o'clock. Keleto is a grade 10 learner in high school and who lives in Tembisa, and she's the character of the show that is being initiated to start smoking. In the smoking scene, she is being pressured into smoking, and this demonstrates peer pressure inflicted on her to smoke as she grieves her late mother. And this reflects how many young school learners are exposed to peer pressure from a young age and are actually pushed to start smoking, basically. And this to us, it also shows that tobacco initiation highlights how media still advertises the use of cigarettes to young children. In February 2024, 183 parties of the WHO adopted new measures to restrict tobacco advertising in entertainment and social media. India became the first country in the world to regulate how tobacco use could be depicted on streaming platforms like Netflix, Amazon Prime, Hulu, and Nigeria recently followed last year. The measures introduced by Nigeria and India the previous slide, the measures introduced by Nigeria and India do prove that governments can intervene to protect their citizens and prevent the next generation from the repeated exposures of tobacco and nicotine products in air. As you can see, we have a popular vaping image that is used within the tobacco space. Vaping contains illicit chemicals, and when heated up, they generate additional chemicals that can irritate the lungs. That is dangerous for people who have never smoked. And smoking vapes does show an increase, as you can see in the graph on the top right corner of a study done by ATOM. The graph that you are looking at of the graph, it does show that as people continue to increase smoking, there's also a high increase of vaping among young learners. Sorry about that. We keep on having technical difficulties. Next slide, please. The burden of vaping has rapidly increased in South Africa, especially among high school students and young adults. Sales near universities make e-cigarettes easily accessible, fueling higher use. A UCT-led study revealed that concerning vaping rates among South African high school learners shows an increase of vaping. And the data also highlights how these products, especially e-cigarettes, are penetrating youth markets faster and fostering early addiction that can lead to long-term health harms. And our key takeaway here as NCAS is that vaping is far more common than smoking among high school learners, with worrying signs of dependence and addiction. A study also done by MRC that is shown at the bottom, using university students, does show that vaping is a mainstream with a high rate of dual use, meaning it adds to, not replaces, tobacco use. And the bigger picture here that we should see is that e-cigarettes is rising sharply among both teens and young adults. Dependence is clear. Vaping is not replacing smoking. So the urgent need for youth-focused regulations is needed. Next slide. Another technical difficulty, but I'll continue. As part of the WHO, FCTC, South Africa has committed to taking strong action against tobacco harm. This includes developing and often updating national tobacco control laws in policy in place to reduce smoking and protect young people from smoking tobacco exposure. It is important that the committee follows through on these obligations, not only to meet international commitments, but to protect the health of South Africa, especially on our youth, and as stated in Article 5.2b. NCAS would like to remind the committee and help them understand this obligation, as it requires government to shield tobacco control policies from industry interference, a commitment that was upheld since 2005, as stated there. Industry interference has delayed important tobacco regulations, resulting in millions more deaths taken up due to recent years of recent smoking. So from 2018, what we also want to share is that from 2018 to 2025, the number of smokers in South Africa rose sharply, increasing the risk of tobacco-related illnesses and premature deaths. This surge means millions of South Africans face preventable health consequences without the urgent policy action. So the two screenshots here, they are security industry documents released as part of the master settlement agreement following the class action of those who fell ill from the tobacco smoke in the US. The industry was compelled to release its secret documents, which are now publicly available at the University of California, San Francisco Library. And this has taught us that this has taught us more so about the industry interference. And it may interest you to note that this letter and the portion highlighted in red on your right-hand side shows how tobacco industry and its allies, supposedly representing farmers and the industry in this case, tried to influence the portfolio committee of then when they admitted as submissions and were less objective during the 1999 public hearings. Honorable member, this is just to draw your attention to the industry submissions, that their submissions are not all objective. These are the principles that we also support alongside with Article 5.3. And then as you can see here, we have two highlighted paragraphs, right? The first one, that's the one that I want to emphasize on, as it's a reminder that Article 5.3 guidelines signed by South Africa during the COP meeting in 2008 is applicable to all government officials, tiers, including parliamentary officials, Chair. Okay, as I'm about to close off my section, just before I hand off to my colleague as well, on the left-hand side, there's a global league table that was released in one of our NCAS reports. It is sad to see that South Africa is at the bottom third in the world, and we should be learning from countries like Botswana, Ethiopia, Uganda, highlighted in green at the first top. This is a clear sign that we are falling behind in protecting citizens from the harms of tobacco. And this is not only a public health failure, but a missed opportunity to lead by example in the African continent. And also, another thing I want to emphasize is that looking at the other countries like Botswana at the top, highlighted in green, Ethiopia and Nigeria, they are at the leading forefront in Africa. South Africa should be leading from this and also be at least at the bottom 50%. And the image on the right-hand side indicates the industry interference. The higher the score, which was 4 out of 5, the more indication of industry interference. A major reason for this poor ranking that I was gathered from this report is that ongoing tobacco industry interference interferes in government policy. And according to this global report, the industry continues to put itself as a partner under the disguise of corporate social responsibility. And lastly, to emphasize my point that this is a clear violation of Article 5.3 of the WHO FCTC, which urges parties to protect public health policies from commercial interests. I'll hand over to my colleague, Ingrid.
Thank you so much, Lungile, for just giving us that insight relating to policy and how policy affects us. So now we'll be going into provisions relating to the bill. We have 6 key provisions that we'd like to highlight and focus on for this presentation. We can move over to the next slide. Started off with clause number 2, which basically focuses on smoking areas. We support control over where smoking will not be permitted, including the introduction of 100% smoke-free indoor and certain outdoor public places. Smoke-free laws are beneficial for everyone, including smokers, because we would be creating environments that protect non-smokers from exposure, to secondhand smoke and aiding smokers towards a smoke-free lifestyle. Studies released in 2021 in South Africa have shown that 25% of smoking areas in restaurants still expose non-smokers to harmful secondhand smoking. This and other public areas where smoking is permitted infringes on the rights of non-smokers to an environment that is not harmful to health or harmful to their well-being, and this is relating to the South African Constitution in Section 24B. we recognize that the proposed bill does not want to normalize smoking and vaping amongst its citizens. Clause number 2 makes it easier to enforce smoke-free laws and aligns with the current Cannabis Private Use Act of 2024, which prohibits the smoking of cannabis vapes in public. This will ensure for a holistic regulation of where vaping smoking will not be permitted. Another thing that we'd like to highlight is that the bill should empower non-smokers in their private residences by prohibiting smoking in a manner that interferes with other residents' rights to use and enjoy their property. The home remains a site of intense and consistent tobacco smoke exposure, not only to non-smokers, but of course to children and other adults in the home. Can you please move to the next slide? As the Council Against Smoking, we usually get a high number of complaints concerning relating to non-smokers being burdened by secondhand smoke. This is in terms of people being exposed in public spaces, some in work and in some in their own private residences. The nature of these complaints highlights the need for stronger regulation for smoke-free places. Complaints also show a gap in some areas like freehold title houses, needing urgency on the tenant to be enacted. This also signals that the need for clear enforcement frameworks and resources is needed, so the bill is not only passed but successfully implemented. Next slide, please. And then we look at advertising and promotion relating to clause number 3. Patterns are showing that there's a rise in e-cigarette smoking among young people. This is something that is happening not just in South Africa, but globally too. Most of these young people who engage with products would have not smoked before, prior to not smoking vapes. And so advertising restrictions are key in preventing initiation and dissuading the youth. So in clause number 3, it proposes that advertising for e-cigarettes and related products be prohibited due to the fact that these provisions have not been included in the current Act of 1993. Advertising restrictions are key in preventing initiation and dissuading the youth from engaging with the products. It also doesn't spark temptation to current users, of whom a portion is seeking to quitting in smoking. So also these products are advertised and promoted through various avenues, including the use of flavors such as dark cherry and forest blueberry. We also see that the use of social media influencers is quite prominent, as we see on our social media pages for the popular vape brands that are using influencers. Also, we see the use of event sponsorship through youth events such as Hey Neighbor and Cotton Fest. Currently, novel products go as far as advertising through brand stretching and brand sharing. For example, you'll see the picture at the bottom. This is a vape product called Nasty, and they've also created an energy drink called Nasty. So when you buy a disposable vape, you also get a free Nasty energy drink, which is a form of brand stretching. On the right corner, we see how competitions are run on the internet in order to promote sales. So the internet sales and promotions is also a big gap that we need to address. When we look at this, that vape manufacturers are basically dodging regulations. They're selling a lifestyle that hooks young people through the exploitation of the internet and keeping their brand identity alive in a customer's mind. Can we move over to the next slide? And then in terms of point of sale, NCAS supports clause 3, which focuses on the introduction of new provisions on how tobacco products are displayed at point of sale. So the effects of displaying tobacco products at point of sale influence how young people engage with these products, because they do want to experiment because they look so attractive. Also, it promotes social acceptability of tobacco products within our society. They also increase impulse tobacco purchases. Even if you had no intention of buying the product, you will buy it because it is right in front of your face. And also, it undermines the quitting attempts by people who are looking to quit smoking. It's important to note that tobacco product displays at point of sale are an important measure of marketing. We are all familiar with current display points at point of sale, where tobacco products are openly displayed in illuminated lights, attractive colors, and so advertising restrictions are key in preventing initiation and dissuading the youth. One of our partners, the South African Tobacco-Free Youth Forum, they have run a study, and their study has shown that 68% of point of sale displays of tobacco tobacco products is actually in the eye level of children, and 53% of these displays of tobacco products is also near sweets and chips. That alone then shows that there is a marketing tactic that is used to make these products more accessible to young people through the use of marketing. The bill is not calling for the banning of tobacco products, but rather regulation relating to the display of the products. Regulating product display simply limits the visibility and promotional power of tobacco and nicotine products. It does not restrict their legal sale to adult consumers. Next slide, please. And then when we look at clause number 5 that addresses standardized packaging and the labeling of tobacco products and e-cigarettes, we have seen that over 18 countries in the world have fully implemented plain packaging. This includes Australia, France, the UK, Norway, as well as New Zealand. And in New Zealand, the study was conducted where smokers have actually showed support for standardized packaging. So there was an increase of 30% of smokers that supported the plain packaging, which also went up by 42% once this regulation was implemented in the country. When we bring it closer to home, Mauritius has of recently, in May of 2023, implemented plain packaging in their countries. And when we look at studies in South Africa, we've seen that the UCT has revealed that South African smokers themselves preferred not to buy plain packs, and non-smokers preferred not to try products due to plain packaging. So standardized packaging, together with graphic health warnings, reduces the misleading effect of packaging and decreases product appeal, and ensures that health warnings are highly visible and impactful. If packs are not going to remain intact as proposed, we would propose that single sticks must carry warning labels as done in Canada and also recently in Australia. As you see on the images there, it actually shows a warning label on the cigarette in itself so that smokers can be aware of what it is that they are consuming and how it will affect their health. Moving over to the next slide, please. Continuation of these clauses, we would like to emphasize that we are not calling for a ban on e-cigarettes, but rather we are advocating for a clear provision to regulate both nicotine and non-nicotine electronic delivery systems. This includes amplifying the same strict packaging and labeling requirements used for traditional cigarettes and recognizing that these products remain harmful. South Africa would not be the first country to introduce plain packaging in vapes. Israel has introduced plain packaging, and this is required for all available tobacco products, including heated tobacco products and e-cigarettes. Another thing that we have noted in the bill is that there is a clear differentiation between clause 4 and clause 5. Regulation of e-cigarettes and non-nicotine devices and tobacco devices must be mandatory and not optional. Using may in clause 5 leaves a loophole in the implementation of the provision. Just as traditional cigarettes are strictly regulated for packaging, labeling, size, and shape, the same must apply for e-cigarettes and related products to prevent misleading marketing. Next slide, please. And then we move over to clause number 9 in terms of restrictions of sale in respect to relevant products. We support that there should be restrictions on where and to whom, based on the age of those ages under 18, e-cigarettes should be sold as a means of protecting young people. The South African Pharmacy Council has banned the sale of e-cigarettes and vapes in pharmacies. They have moved in terms of this because they have reflected the concerns about the potential health risk associated with vaping, especially amongst young people. When we look at courier delivery and online sales of e-cigarettes, they pose a significant threat to public health risks by enabling easy youth access through weak age verification and bypassing local restrictions. These channels also undermine regulation on product transparency and marketing, allowing harmful products to reach consumers with little or no oversight. And as we see here, Mr. D, one can easily buy these products and there's no real verification on whether you're over the age of 18 or not. Next slide, please. Then the National Council is in full support of the establishment of a product monitoring committee. This committee will be instrumental in the implementation, monitoring, and evaluation of the policy. We propose that such a committee includes academics as well as public health experts, tobacco control experts, and we also caution that this committee should stay away from having inputs from the business. It's important for us to look at the fact that the goals of tobacco industry and the goals of public health will never align. One is seeking to protect their profits while the other one is seeking to protect lives. The Minister of Health has held regulatory power since 1993, and these powers have been used responsibly to strengthen tobacco control through timely evidence-based updates. Retaining these authority in clauses 12, 13, and 14 ensures that the bill can adapt swiftly to new products and industry tactics without delaying. A prime example of this is that in the designation of a 25% smoking area in restaurants, when the Minister of Health exercised his powers to allow smoking in prescribed portions of public spaces, this demonstrated that how effective the use of his power was, which was shaped and which has ultimately shaped the social fabric of smoking spaces in South Africa and can be further strengthened through this bill that we hope will be passed. And then we just quickly want to touch on illicit trade and also just debunk some myths that are associated with illicit trade. It's important for us to note, honorable members, that tobacco control does not increase illicit trade. I would like to say that again, that tobacco control measures do not increase illicit trade. Also, tobacco control it does not, using plain packages does not increase illicit trade whatsoever. But also a very important thing that I would like to highlight is that South Africa must introduce measures to secure the supply chain, including a track and trace system, especially for legally licensed manufacturers who are fueling the tobacco market with illicit products but are crying foul. And then quickly, we just want to touch on harm reduction. The purpose of harm reduction is to improve the health of a population by eliminating or reducing their consumption of tobacco products and exposure to tobacco smoke. In South Africa, harm reduction refers to the prescribed medical tools like nicotine replacement therapy or opioid substitution therapy, which are used under the guidance of healthcare professionals. Now, if we look at it, opioid substitution therapy is not sold over the counter, and nor is it used for recreational use, and it also shouldn't or doesn't have any graphic or color warning, graphic or colors or flavors used for it, clearly indicating that what we have in the market now isn't necessarily a cessation tool. In our observations, harm reduction harm reduction, as it's been presented to the committee by other parties that have made presentations, have basically been able to come forward by showing that they actually want to maintain addiction rather than solve the issues that we have in this country. Unregulated products like vapes and nicotine pouches are designed to create and maintain poly-addiction and not to end it at all. As you see on the graph right there, it shows that there has been an increase in e-cigarette smoking over the years. But also we see that there has been an increase in terms of tobacco smoking. And if these products were used as a cessation tool and they were available as a cessation tool to everyone, the e-cigarette smoking would have, or rather the cigarette smoking would have gone down. But instead, cigarette smoking has gone up over the years. And then just before we finish up our two last slides, we believe that switching to another product that maintains addiction is not stopping, and we recommend evidence-based cessation that does not always require medication. As mentioned in the beginning, NCAS runs the National Frontline, where we provide cessation support services to individuals looking to quit smoking. So NCAS recommends an integrated method to assist smokers in successfully stopping to smoke. On the screen to the left is a study that was conducted in Tshwane. 21% of the subjects who received counseling had stopped smoking and did not relapse over 6 months, whereas 9% of those who did not receive any counseling were also able to stop smoking. We recognize that counseling may be limited in reach, and therefore we also support the use of SMS or WhatsApp messages that can be used as used in the UK, shown in the image on the right. And this is an effective cessation tool that goes hand in hand with counseling. So NCAS highly recommends that interventions need to be introduced to smokers that can help them quit smoking, and scaling up how government is able to provide evidence-based interventions for people looking to quit smoking. We, as the National Council, we are ready to support government in scaling up cessation interventions beyond the current quit line, and recommend that professional provisions be made to expand these measures by empowering health promotion staff at community level while integrating innovative technology-based solutions such as a text-to-stop program that provides long-term accessible support for smokers. And then lastly, honorable members, I'm just going to go through this. These are the recommendations that we'd like to place before you before we go into questions. Firstly, like I'd mentioned before, we'd really feel it's important for us to replace the word may with the word must, because the use of may is in regulatory clauses gives discretionary power, which can weaken future regulation and enforcement thereof. Also, it's important for us to add a clear definition of nicotine products. We also would recommend that we replace the word leaf with plant, because other parts of the tobacco plant can be used in the manufacturing process. We also keep the clause, important that we emphasize on the clause relating to Article 5.3 of the WHO FCTC. We really, really want to stress that this is important and should be included in the bill. And then also we want to see that there is a clarification, a clear scope in paragraph 5 by adding nicotine and non-nicotine products. And then also we're looking at how we can strengthen health warning requirements on tobacco and nicotine products. Warnings should cover at least 75% of the total surface area of a pack in line with WHO FCTC guidelines. And then lastly, like we have said, we are willing to provide support in helping in scaling up the cessation support services that are being provided by government. So government should be scaling up support beyond the quit line and also beyond brief counseling in order for us to see how it is that we can leverage technology and ensure that we're able to provide the best support for smokers who are looking to quit smoking. As we close up, I think it's important for us to also emphasize that we are in full support of this bill, and we are really looking to work hand in hand with government to ensure that this is implemented effectively. And we know that this bill isn't just a bill that is focused on young people and focused on protecting young people, but also how do we use this bill, and measures are there that show that we can use this bill to also protect non-smokers as well as smokers who are trying to quit smoking by providing support that will allow them to live smoke-free lives. Thank you so much to the committee, and I think we'll open it up for questions.
You will notice that I pay back your time, which I taken up, and you have taken another 1 more minute after that. You did pay your time back. Thank you very much for your presentation. We will now get members who would like to participate in asking questions. And I do recognize in the following order. Please, honorable members, I'm not writing down the numbers as I'm sharing the driving with them. But number 1 is Honorable Dr. Leroux, followed by Honorable Van Staden. So those are the 2 hands. Please raise our hands 1 time, colleagues. The 3rd one is Honorable Shabangu, followed by Honorable Sine. Number 5 is Honorable Zungula, followed by Honorable Kumalo. Number 6 is Honorable Chirampungoso. Welcome, Honorable Chirampungoso. Your apology of not logging in on time was noted and it was recorded. And number 6 will be Honorable Dr. Letlape. Any other person I have not called?
I'm Mhlongo, Doctor.
Honorable Mshongo. You
Yes.
will follow Honorable
Seven.
Dr. Letlape. Okay.
Thanks.
For also, sir.
Yeah, note Honorable Teko, you will follow Honorable Mshongo. Honorable Mare on the platform? Not as yet. Honorable members, if I were to start, Honorable Dr. Number 1, Honorable Dr. Leroux, followed by number 2. Okay, Honorable
Honorable Maria, I just want to apologize for locking on too late, but I don't have a question now. We'll wait for the next one.
Okay,
thank you.
Thanks. Number 1, Honorable Dr. Leroux. Number 2, Honorable Van Staden. 3, Honorable Shabangu. 4, Honorable Sine. 5, Honorable Zungula. 6, Honorable Kumalo. 7, Honorable Chirampungose. 8, Honorable Dr. Letlape. 9, Honorable Mshongo, and 10, Honorable Teko. In that order, one after the other, honorable members. Thanks.
Thank you very much, Chair. Thank you very much to the presenters. I just had a few questions in connection with your presentation. I was interested to see you've mentioned in the bill that they are banning vapes from pharmacies because of there's this intention of not giving people the impression that there are benefits of vapes or that it's a medicinal product. But I mean, it's interesting because we've had many presenters who are concerned about vaping, mentioning that, for example, in Australia, vapes are only sold in pharmacies. So and we've had presenters from the Public Health Association of South Africa saying that a vape should be available as a prescription to help people to stop vaping. So I just wanted to get your perspectives on using vaping as a way to help stop smoking. I think that there are the Cochrane study that showed that people who use vapes are more successful than people who use nicotine replacement products on their own. And so I just wanted to see, I mean, you are also involved in smoking cessation activities. So that would be interesting to hear your perspectives on that. I know, I mean, I completely agree with you around the need for vapes to be regulated very carefully and that they should absolutely not be available to children. But I think that in adult smokers, I would like to hear your perspectives on that. I was interested in your submission around track and trace. Do you? I mean, I agree with you that it would be good to have that to cut down on the illicit trade. Is that something that you think that should be in the bill? So that's the second question. And then I think that just the third question was around the recommendations that you make at the very end. Some of those you talk about which paragraphs they're on, but where you talk about may versus must, are you saying that this should be through the whole thing, or is that in specific places where that should be different? So it would be nice either if you submit it at the end or that those recommendations that we see exactly where you intend those things to be different. And I think that my last question was just around smoking
Now,
cessation service.
Honorable Dr. Leroux, you wanted to give it to three. Let's try and limit ourselves to the top three.
No problem. That's fine. Thank you, Chair.
Thank you, Chairperson, and thank you to the presenters for your presentation. Good afternoon to everybody. Just, well, I will limit my questions to three. Question number one from my side is the comments are usually made here, and we have also heard the same comments during the public hearings that the tobacco companies are behind the illicit trade in order for them to make more money or avoid taxes or etc. My question to you is on this matter. Do you have any evidence that can support these views? And if you have, are you willing to hand it over to this committee? My second question is, and it is relating to that any government in any country can have any sort of legislation that is protecting the youth or youngsters against smoking. However, if people want to smoke, they will do it regardless of the legislation that is on the statute books. So my question on this is, don't you think that youngsters and the youth will smoke less or not smoke at all if the parents and family members teach our children at home not to do it? Education certainly starts at home in this matter or in any matter at all. And my last question is, do you have any scientific evidence that can support your views on this matter? Because we as a committee have been asking everybody for scientific evidence, and I wonder if you can help us in this matter. Thank you very much, Chairperson.
Thank you, Chairperson, and thank you for this presentation. And let's appreciate that at least some of these presenters, they are there to protect the youth against tobacco. My first question on the presentation is, what are your views on how e-cigarettes are accessed, and what recommendations do you have on how these products should be accessed? While answering that, please also explain to this committee what is your take on the online sales and the youth. Do you think it will cap the accessibility of the product by the youth if these products they are sold online? Thank you, Chairperson.
Thank you, Chairperson. Let me appreciate and welcome the presentation. And Chair, it's very encouraging and to see young people presenting before this committee on this bill. Thank you so much for your detailed and evidence-based submission. Like I said, we note and support your emphasis on protecting the youth and also making sure that we close the loopholes and strengthening enforcement mechanism. My first question, you support restrictions at the point of sale. What recommendations would you have for an informal trader looking to continue selling the products? My second question, Chair, please provide clarity on the advantages and disadvantages of flavors in these products. Is there any relation between adding flavors and the use of the products by the youth? Thank you, Chair.
Thank you, Chair. Let me greet you, Chairperson, the colleagues, and the presenters. Just to allude to what Honorable Senate just stated, that it is really encouraging to see young Black women taking up space and contributing to the policy formulation in our country. It is really something that personally I feel very proud for the presenters today. I've got a few questions though. The first question, it is in relation to the part where the presenter spoke about that tobacco products should be sold in prescribed packaging. That would, in effect, mean that the sale of loose cigarettes would be outlawed, given the fact that loose cigarette cannot be sold in prescribed packaging. Therefore, is a suggestion therefore to say that informal traders, which we see in the streets, by the robots, selling in the spazas and the taverns, should be criminalized because it is mostly them that are selling the loose cigarettes. And would that not have the effect of increasing tobacco? Because if one is legislatively barred from buying one loose cigarette, they need to buy a minimum of 10 or 20. Would that not have an effect of increasing, therefore, the quantities in which a person buys tobacco in terms of the larger quantities? The second question, it's in relation to the fact that is there no concern that the scaremongering about vaping could deter smokers from trying vaping on the belief that vaping is harmful, if not more, than smoking? Would you not consider this to be a perverse outcome of your messaging around vaping products? Then the last question, it is about the issue of complex human behavior, because the human behavior is complex. You may have a law now. It is not to say that it is going to happen as per that law. We saw what happened during the times of COVID, whereby there was a ban on cigarette sales. Instead of people stopping the consumption of tobacco products in terms of buying tobacco products, we saw a spike in terms of illicit trade. Now, I want to understand from the presenters as to the principle you are using. Are you suggesting a principle that says all harm is harm, whereby there is... Sorry, Chair, about that. I got disturbed a bit. A principle that says all harm is harm, whereby all products are treated the same regardless of the different level of harm.
Honorable Mare, please mute. Sorry, Honorable Ngula, continue.
Yes, so I'm saying that, are you suggesting that, wanted to understand your principle, is your principle that the committee and the department must follow the all harm is harm principle, whereby all products are treated the same regardless of the different levels of harm, or a principle of harm reduction, whereby less harmful products are availed given the complexity of human behavior? Thank you, Chair.
Thank you very much, Chairperson. Greetings to all honorable members and our presenters on the platform. Let me start by accepting the report, the presentation from the presenter, Chairperson. My question is in relation to the illicit trade. I want just to check with the presenters whether do they have any suggestions on how this can be tackled in South Africa. Thank you, Chair.
Thank you, Chairperson, for the opportunity. Ngibulise, my colleagues and the presenters, thank you for your contribution. Nginembuzo emithu igama lami uNayili Mpungose from EFF, and I have two questions. You can say three. Eyokuqala is to ask if this bill is sufficient in the aspect of encouraging prevention, right? Because it's a principle of the Department of Health. Is this bill sufficient, particularly in the scope of young people? And then second to that, what would they recommend as enforcement tools? Example, like penalties for non-compliance of retailers and manufacturers in relation to bill implementation. And in relation to those recommendations of what could be the enforcement tools or penalties for non-compliance, should these enforcement tools be reflected in the bill? Yes, thank you so much, Chairperson.
Chair, I'm not too sure if it's me now. My counting is not so good, but I'll go ahead if it's.
Yeah.
Just one comment that harm reduction is not a prescription tool only. Even social behaviors contribute to harm reduction. So education and informed decision making on a do-it-yourself basis is critical. Now, linked to that, my question is, for those 12 million who continue to smoke, who've tried helplines, who've tried quitting and are not succeeding, what does the council offer those? Should they be condemned to the dustbin, or what do we do with them? Because they are the ones that contribute to the more than 20,000 deaths that we have annually and are part of the 12 million people who smoke. Related to that, adult smokers, do they have a right to be given information about alternatives to combustible cigarettes if they can't quit? And if so, how does the council suggest we reach them to inform them? The last question is you saying that banning or forbidding smoking from public spaces would also be good for the people who smoke. Can you explain? Can you expand on that? How can it be good when you're going to be arrested and there could be sanctions against you? I just want to understand how the council comes to that determination. Thank you, Chair.
Honorable
So I
Mhlongo.
think, yes. Thanks, Chairperson. Good afternoon to my colleagues and the presenters. Chairperson, I would like to salute and be thankful to the council, because when we look at it is said that cigarette smoke contains 4,500 chemicals and 200 known poison, as well as 60 chemicals that can cause cancer. So if this mode of prevention or of combating is going to take place, it is going to help us and our children. I just hope and believe the intervention of the committee of the council be positive, and the bill seeks to better protect our children from passive smoking. But I'm having one question on the advocacy theme or method for the adoption and implementation of comprehensive and evidence-based tobacco control policies, as well as the provision of support on the cessation of tobacco and electronic delivery products through the provision of behavioral cessation. Do you find it easy to put this control measure easily? If not, what challenges are you facing or do you encounter? Thank you.
Thank you very much, Chairperson. Good afternoon to all those connected to this meeting. Chairperson, let me join my colleagues in appreciating the presentation by the representatives of the council, which are women. On this time. Chairperson, it's good to have women or people, citizens of their age, showing interest in policy making. That's encouraging. I don't have a particular question, but I find joy when they are making emphasis on some of the clauses in the bill, and also highlighting the importance of the clause that talks the recommendation on smoking in public spaces, and also that they are emphatic on the point of sale, the display on point of sale. They showed interest in that clause, and also them being young but interested in a bill that protects different ages or different categories of people: the elders, the youth, the non-smokers, and second-hand smokers. Chair, I want to appreciate the recommendations that they have made to the committee. I will again go to their presentation and look at those recommendations and establish if they cannot find space when we deal with the bill as the committee. I thank you very much, Chairperson. I wanted to raise that. Thank you.
Okay. No, thank you very much, Honorable Tsheko. My comment is that, honorable members, I'm sure most of us will say you may not agree with everything they said, but the eloquence and the confidence that they displayed in this presentation makes one proud that they have really had some time to reflect and study this topic, and they are able to actually argue their points on it very well. To the young people on this team, there is something that you might be called upon to say you are protective of the non-smokers and you don't make room that in any part of the world there will always be smokers. If you take them too far away from where are you accommodating them in that space when you're saying, look, ban, make them to be too far away, because this is not accommodative of that. Number two, which is the last one, have you noticed that on the bill there is absence of these other products we call nicotine pouch? And if you then do understand that there are those products that are absent in the bill, what is your recommendation to insert it? Because you can't have a bill that talks to 7 other things, and then there are things that we know already in the market. One of them is nicotine pouches, and we don't regulate on them. Thank you very much. Can you then respond to these questions? And you will start now at 4. At 4:10, you should wrap up your comments. Thank you very much.
Thank you so much to the committee, and I think thank you so much for just the support that we're getting as young Black women that are really championing for getting legislations that really save young people and also save the country as a whole. I think let me start off with you, Chair, in terms of the 2 questions that you had asked relating to whether nicotine pouches should be added to the bill. And like other speakers have spoken in the past, I think it is important that it should be added in the bill so that we don't have to look at doing amendments in the future, because nicotine pouches also are a form, they have nicotine, I think the name in itself says it, and we have different variations of nicotine products that come over time. So it becomes important for us to ensure that when we are looking at this bill and we are refining it before it goes into signing, of course, we ensure that nicotine pouches are absolutely included in this bill. Another thing that I would also like to speak about is that you're also talking about whether this bill is accommodative of smokers. I think there has been talks around how this bill is only focused on young people and it isn't smokers focused on smokers. The stance that we have, obviously, as the National Council Against Smoking, is that we are advocating for a tobacco-free South Africa. A tobacco-free South Africa is a South Africa that is also inclusive of knowing how it is that we're able to provide support to those who are seeking to quit smoking, but also those who are on tobacco products and may not want to quit smoking, and they feel like laws that are in place are actually against them. And I think this isn't the case, but rather it is to ensure that we create environments that will actually sway them towards considering quitting, because at the end of the day, we are dealing with a nicotine addiction. So when we're able to address those, it makes it easier for us to see that we have a bill that is inclusive of smokers, of non-smokers, and I believe that this bill is a reflection of that through the provisions that we had discussed. And then I just quickly want to go talk through to Dr. Leroux. Thank you so much for your questions. You had spoken about how the Pharmacy Council how it is that obviously they've introduced bans for vaping products in pharmacies, but we're seeing this happening. We're seeing that these are not banned in other pharmacies internationally. And we did see that there was a pharmacy council that was on the committee that spoke about if there can be thorough studies that can be done that will tell us what are the contents that are in these nicotine delivery, electronic delivery systems, that would then give them something that will substantiate whether or not these products should be in the pharmacies or not. So at this current moment, we actually don't have any clear evidence of all of the other extra chemicals that are in these products that hasn't been proven. And as a result, it shows that we are still dealing with products that are quite dangerous because there is no clear evidence of all of the chemicals that are in these products that support whether these can be fully implemented as cessation tools in our pharmacies in South Africa. So it's important for us to really ensure that SAPRA regulates these products. And in order for them to regulate these products, studies still need to be done in terms of looking at what are all the contents that are included in these products. And then in terms of the differentiation relating to the may versus must, we spotted that particular clause in clause 4 and 5. However, I think it is important for us then to possibly go into the bill and look at every single regulation and see whether the may is possibly a loophole. The fact that some areas have a may and some have a must, that differentiation shows that we have a problem that we need to be resolving. So obviously, like we've mentioned, there's a monitoring committee that would be involved, and through that, we look at how it is that we ensure that these regulations are tight and that they are in place. And then going forward to Honorable Van Staden, I like the fact that you bring forward the fact that young people will engage with these products whether they like it or not. And it becomes, shouldn't it be the responsibility of families to come forward and to teach their children whether they should be engaging with that product or not? And yes, it does become the responsibility of family, but also becomes the responsibility of society, of communities, of government, of public health experts, of organizations like ourselves as anchors. The work that we do isn't just providing cessation support. We go into communities to advocate for why it is the dangers behind smoking, whether you're smoking a vape, whether you're smoking traditional cigarettes, what are the health harms associated with it, and how this affects our community. So not only is this an approach that is important for just government, but also we're looking for a holistic approach where we can help young people and help those who are smoking to quit. So policy environments must also make it easier for us to be able to make it unpleasant or undesirable and for them not to want to engage with these products. And that is the purpose behind the bill, because the moment that we have a bill that is in place that can support how these products are, how e-cigarettes are regulated, how it is that there's plain packaging, how it is that these are displayed in front of young people, this helps dissuade young people from engaging with these products. I don't know if I should be handing over to the rest of my team to answer some of the other questions that you guys have.
Okay, just to answer the question about recommendations for informal traders, we would recommend that maybe these e-cigarettes, the cigarettes basically could be sold in a container and have the popular ones like your Stuyvesants at the top, and then the other ones in the container, so that there are no new initiations and need for smoking. And then the other question I just want to touch on is about the enforcement tools and the penalties. We do want to say that the bill is sufficient enough, as it does provide sufficient information, and also the enforcement tools for the implementations are in the bill. And then I'll hand over to our last team member to answer some of the questions.
Thank you, honourable members. Given the time limit, a few scientific questions. One related to, first of all, I think we need to also clarify that we had made the recommendation to the extent that the option to have single sticks not prohibited would require health warning, because we also don't want disparities in terms of health warning. In terms of complexity of behavior, is for the same reason that the risk communication needs to be very carefully guarded and designed, because health literacy does affect the eventual understanding, and social judgment theory says depending on where you are, you may be able to understand information differently. So indeed, it's true that not every law that makes people change, but you create an environment that makes it easier in terms of social cognitive theory. Now I'm going to move. What do we do with 12 million people who continue to smoke? Indeed, this bill does address that to make sure, and that speaks to what the chair also talked to. There's a misunderstanding that this bill is only about prevention. The cues that make addiction and trigger people to smoke, even ex-smokers, we say addiction is a chronic relapsing disease. So even if you've stopped smoking and you see a cue like a glamorous display of cigarette, it may trigger your receptors to crave nicotine. And this is why this bill is necessary to maintain those who have quit and for those who wish to quit. What does NCAS believe? We do not believe the use of vape as a population-based strategy. It may have some benefit as a high-risk strategy, just like your opioid substitution therapy. If a smoker's come, if he says, I have used NRT under supervision, and I must say that's what Cochrane does. The Cochrane study, although there are just 4 studies with 2,500 people, is a clinical setting that is controlled. It cannot be used and equated to a population-level intervention, particularly in South Africa, where population studies have shown otherwise. Therefore, as a high-risk strategy, supervised, you can tell the patient, if you've used this, if your intention is to quit eventually, and you want to move to this particular product, you may be able to use that. However, understanding that your risk would not go down, for example, coronary heart disease, it takes 1 year to 5 years to come to that of a never smoker. And as long as you are exposing yourself to nicotine, you may not come down to that level. And therefore, as an interim, we may be able to support you. So we are saying the best we can do for those 12 million smokers to create this policy environment, use scaled technology, use NRTs, use the varenicline, all cessation aids to make sure we support all the smokers. Thank you very much. I think we'll leave it there.
Thank you very much. Thank you. Thank you very much for your input. We will interact with your presentation, as Honorable Kako said, and also with your responses as we tie up our collective discussion on the bill. Thank you very much. Ms. Machalamba, have you managed to get Pheli, who were third presenters, to come now? And we want to apologize to Pheli for bringing you now earlier than you had expected. I hope Ms. Machalamba is able to get number 3, number 4, number 5 to come also earlier than they were supposed to be. We'll give you 30 minutes starting from now at about 4:15. So at 4:45, you would have finished your 30 minutes of interacting with us. Thereafter, honorable member members will interact with your presentation, and then come back and then wrap up with your response. Are you able to log in and give in sharing rights? Ms. Machalamba,
Sorry, Chair, can I suggest that if Pheli Youth is not ready, we check if Amandla.mobi can present, then Pheli will follow after Amandla.mobi. I think Palesa is on the platform also.
Amanda.mobi.
Yes,
Come
Chair,
on.
we are available.
Start. Now you'll give you another extra minute because to give you. So start at about 4:45, another extra 1 minute thereafter. Thank you. Start.
Sorry, Chair. There's a problem with my network. I'm sorry, I couldn't be able to respond quickly. There was a problem with my network this side. There's a problem, electricity issue.
Who is that who has the electricity problem?
It's Pheli Youth Chair, so they will present after Amandla.mobi.
Yes, Amanda.mobi is presenting now. You come thereafter if you are then able to log in. So Amanda.mobi, please go ahead. We called on you, Palisa, to start. Is Amanda also having a challenge?
Palesa, can you please try and sort out the video on your presentation? I mean,
Okay, let me just
volume on
try.
the presentation. Okay.
Apologies for that. We're having technical difficulties. Let me share my screen again. Can you see my screen?
Yes, we can see, but the video doesn't have a volume. We can't hear anything.
Okay, let me do this. And let me just remove. Please let me know if you can hear my sound now. Good evening, honorable members. My name is Pheli and campaigner at Amanda.mobi. We would like to thank you for granting us the opportunity to speak with you today. Who are we? Amandla.mobi is a movement of over 960,000 members, and we lead campaigns that build real people power for Black people, with a particular focus on low-income Black women. Now, over the years, the Amandla.mobi community has run various campaigns, such as removing VAT on sanitary pads, our food pricing campaigns, and campaigning to increase and extend social grants. Another campaign that our members have been concerned with is the Tobacco Control Bill. I would like to remind members of this committee that since 2018, the Amanda.mobi community has been urgently calling on you to pass the long overdue Tobacco Control Bill. Over 12,000 people have stood in support of banning smoking in public places, plain packaging, and graphic health warnings on packets, and for e-cigarettes to be regulated the same as tobacco. We are not only here on behalf of the 12,000 members of Amandla.mobi who submitted public comments back in 2018. We are also here on behalf of the 54 million people in this country who do not smoke. We are even here on behalf of some smokers who actually support the bill. Honorable members, please allow me to take you back in time. Do you remember a time when teachers used to smoke in classrooms? I know it sounds unbelievable, but this was the reality for many until new regulations were put in place by the government in 1993. But why had the government not acted sooner? In their paper published in 2003, Mia Milan and Rosemary Lever outlined the relationship between big tobacco businesses and government. Government eventually put public health before profits, thanks to the work of health activists. And we wonder whether these relationships still exist today. To protect their profits and distract politicians, the tobacco industry always claims that regulations and tax increases will fuel the illicit trade. There is no evidence of this, yet some of this committee's members have accepted industry's claims. One group that has had a significant presence during public hearings has been the organization Clear the Air, which is currently spending a lot of money pushing the illicit trade issue. Clear the Air has links with the tobacco industry, and this committee should question what their true agenda is: public health or industry profit. Clear the Air has run an extensive PR campaign along with events which have amplified certain voices. For example, William Stewart and so-called research group Provado. What Clear the Air does not disclose is that some of their arguments, based on Provado Research Survey, were funded by Philip Morris. It's convenient that the study suggests exempting vaping and further stalling the tobacco bill. This is a huge conflict of interest. Clear the Air is amplifying the tobacco industry strategy of delaying and diluting public health interventions. The illicit trade is a red herring used to distract. By giving William Stewart and Provado a platform, Clear the Air has helped publicize Philip Morris's arguments that the bill will increase the illicit trade. Philip Morris has paid Provado to do similar studies in other countries. The founder of Clear the Air, Thabang Pepe, is the operations director at the Agape Youth Movement. Agape and Clear the Air attended an event organized by the Consumer Goods Council to push the illicit trade agenda. It's important to note that a key speaker at the event was from British American Tobacco, which is not only a member of the Consumer Goods Council, but one of the executives sits on their board. Clear the Air has shared content to help amplify the illicit trade issue, including interviews by known tobacco industry associate Yusuf Abramji. According to the University of Bath, who researches and tracks tobacco industry tactics, Abramji is a spokesperson for the so-called Tax Justice South Africa, which is funded by tobacco industry body, which includes Philip Morris, British American Tobacco, and JTI. Work and data tracking by the University of Cape Town's research unit on the economics of excisable products has pointed out how the tobacco industry funds youth and community organizations as part of their PR strategy. The UCT unit has highlighted that Clear the Air has not disclosed its funding sources nor connections with the tobacco industry. And before you ask, we've always been very transparent about our funding sources. We don't accept funding from anyone or any entity that would compromise our mission to create a more just and people-powered Mzansi. Even with the budget to run a large Facebook advert campaign, Clear the Air has only collected 193 signatures. This should be weighed up against the over 12,000 public comments in support of a strong tobacco control bill. This is a clear public mandate for this committee to put health before profit. We would have loved to organize some of the 12,000 plus people to attend the committee public hearings, but we don't have that kind of funding. So the committee should be very careful about attempts to delay and dilute the bill by using illicit trade as a red herring. This bill has nothing to do with the illicit trade. Illicit trade is a law enforcement issue and involves the Department of Trade and Industry. If we really want to tackle the illicit trade, SAPS and the DTI is where this conversation should be occurring. If we really want to clear the air, this bill should be passed immediately. We've been waiting for 7 years already. We appeal to each of you as committee members. Do not be manipulated. Honorable members, I want to remind you of what happens when the government lets industry have its way. We will have a repeat of 2014 when big business that make food like Poloni did not agree with government's proposed hygiene rules and instead wanted to self-regulate. We lost so many lives to the listeriosis outbreak, and we cannot have the same happen with tobacco.
Oh, Noma, I see you ate all your lunch. Marushi Polo, Yindab.
Yo, Mama, Poloni ka go bolaya.
Ini?
Ikule ba Poloni feditse batho years ago. Na ne ke sa batle go swa o go tshwara di-bucket.
People died in 2018 because of umshikashiko busy listeriosis. Yabona ngani yam, people ate food that made them sick, but today, ama business amakhulu. kumele balandelele ama-government aging rules.
Manje, why were they following rules before 2018?
That is because business amakhulu sat with the government at the table and refused to follow the rules. It was only after 5 years sekshona abantu abaningi bese ila uhulumeni wafaka khona imithetho.
Isn't the government supposed to put people first?
Many big businesses agree, and some are chummies with the politicians. But if singahlangana singabantu, we can demand the government to put people first and not profit.
They deliberately use tactics to mislead and distract from the main issues and arguments, which are their life-threatening products. We know they don't care about clearing the air and have used the illicit trade narrative to make themselves seem as victims. They even got to the chairperson of this committee.
Miss Hunter, I am glad you are here. And this is our last meet. More than 5 participants spoke about the issue of illicit tobacco. Whether it's in the question or not in the question, there's something that the department must deal with that. You can't leave it, and I'm saying this, you picture this, you can't leave it to some other institution in the country to deal with it.
The amount of time the tobacco industry and its front groups have been given in these public hearings is extraordinary. I remind the committee that their actions have to be in the best interest of people in South Africa, a majority you were elected to represent. We will be watching this committee closely because no serious member of parliament who is concerned about people's health should be considering watering down or further delaying the bill. This is what one Amandla.mobi member had to say.
Hello, my name is Flo Mavis Shivambu. I'm recording this concern on tobacco because I, for one, I'm a healthcare worker. I see a lot of patients that are affected by the tobacco. Some are staff members that would want to stop smoking at all costs, but they're unable to, and their health has been affected. Myself, I'm not coping as well around the smokers. I cough a lot, even if they're smoking outside. I am affected by what they do. As they come back from smoking areas also, the smell of cigarettes from their clothes also just affect me. I support the tobacco control, including the e-cigarettes and all sorts of things that we see these days in terms of tobacco. I fully agree with the tobacco control in South Africa. Thank you.
Public smoking, I think it's very rude and it's bad for the people like us because we have issues like medical issues, so it's not good for the environment.
All people living in South Africa should have the right to clean air, but secondhand smoke threatens the health of those who don't smoke, especially children. Secondhand smoke increases the chances of people developing bronchitis, pneumonia, asthma, and heart disease. There is no safe level of secondhand smoke exposure. Here are more comments from Amandla.mobi members. Hi, ngithanda ukuxwayisa abantu ngobungozi bogwayi. Ugwayi unobungozi esifubeni, udala nekhensa.
Sanibonani, igama lami uMabuyi, ngihlala eMandeni endaweni yaseNdulinde. Nkosi yami nginenkinga kabhuti obhemayo. Into engiphatha kabi ukuthi ubhemela endlini akafuni uhlobo lokuphumela ngaphandle. Manje into engenze ngalibhalela ukuthi kuneyingane abhemela phambi kwazo. Kwasamina nje iyangihlukumeza indaba yakhe yokubhemela endlini ngoba nginamasayinasi. So bengicela bandle ukuthi ningisize. Ngingabonga kakhulu uma ngingathola usizo.
I support this campaign because a lot of my schoolmates are addicted to cigarettes, both boys and girls. They do not come to class, and I'm worried about the future because they are young. We have also heard horror stories where a woman has had burn marks from her partner burning cigarettes on her when they have disputes. According to the Tobacco Control Data Initiative, each year South Africa spends more than 42 billion to address tobacco-related illnesses like lung cancer, asthma, and bronchitis. At the same time, the country only collects between 11 billion and 13 billion rands from tobacco taxes. This means the South African taxpayer is paying for the healthcare bill of tobacco-related harm while the tobacco industry collects the profits. Our queues at clinics and hospitals keep getting longer, and the government keeps cutting the healthcare budgets while cigarette companies make billions. With these billions they are making, the tobacco industry is mobilizing to protect their profits. They are pushing huge campaigns and targeting people on social media, mostly young people. They are using language, celebrities, and influencers that are familiar and influential. One familiar face was Reason, a famous rapper in South Africa. This is what he had to say.
You can go to jail for 3 months if you smoke in your own home or townhouse complex, and it interferes with other people within the premises. So I'm sitting at home and I'm smoking, and then my smoke goes out the window and it hits somebody who doesn't smoke. I can go to jail for 3 months. Yeah.
Another familiar platform to young people is podcasts. And the Podcast and Chill Network spoke on the bill, and this is what they had to say.
And once again, guys, the hashtag is Stop the Tobacco Bill, yeah? Hashtag Stop the Tobacco Bill. A lot of the time, sinners complain, mara starving, we don't know about these bills that get passed, and it's difficult to change them. It takes many years or even decades.
Some things get gazetted, and what that means.
If we were to do a quick search on Twitter right now with the hashtag Stop the Tobacco Bill, you would see many people using the same hashtag, all against the bill. I personally don't think this is a coincidence. The tobacco industry has spent decades denying that their product kills up to half of its users. But we know that smoking is the leading driver of lung cancer, causing 80% of cases. They have also made claims of the bill causing job losses, but researchers at the World Health Organization have debunked these arguments. The tobacco industry is willing to go to lengths to protect their profits, even if it means lying and spending huge budgets on influencers to shift policy.
What you doing? What you got here?
No. Hello.
It's yours? Okay.
Hello. Hurry.
We have a fraction of the budget the tobacco industry has, but we are able to collect so many public comments because people are concerned about this issue, while industry has to pay actors to spout their talking points.
Yeah, I think South Africa is a problem of smoking. If you look there, these days, everyone is smoking. It's more like it's a trending thing. I don't know if it's what, because now there's vapor and Wakapai and different cigarettes. So everyone is smoking now. It seems like it's a trending thing. So it's bad for community.
In public smoking, it encourages other young people or learners to smoke. At my school, I don't prefer learners must smoke because it can cause lung cancer and TB and other diseases.
It's cigarettes, the traditional cigarettes, whether it's the hookah, whether it's the snuff, the heated tobacco products, the new ones, the e-cigarettes, each one of these carry their own health risk.
Young people have slowly moved away from smoking cigarettes, but they were presented with an alternative. This is what one young person had to say.
Good there. So I'll be speaking about my journey and why I don't agree with vaping / smoking enough. My journey started in, I would say, 2017. I was at the age of 15 and I started vaping. Vaping was this thing, it was very cool. It was like was the in thing at the moment. And at the school I went to, it was like quite accepted that you do it. But obviously, no one really used to look at the packaging and say, yeah, I'm not 18 yet, I shouldn't be using it because it was so accessible. Whenever you went to stores and everything, they would ask, but it was more of like a guideline to them. At the end of the day, they just cared about the sale and not for the health of the purchaser.
The tobacco industry thrives on disinformation. When people are confused, making decisions and choices for their health is hard. The tobacco industry currently leads the conversation on what is safe and what isn't. Health E-News asked young people which one they think is better between smoking cigarettes and vaping. This is what they had to say.
Manje ukugwaya kubayanyanyateka affect amalungs. Lungs amapapayasha. Kana umuntu ugcina sekakhwehlela aze so lento leyo ngibona
Getting myself, and me not think it's bad. Yeah, because like I've witnessed most of the time, abangani bamakhulapha mangase sevani. So I don't think it's fair because I'm paying me for a while.
Ngcono ngoba into ekhona. Leza manje le i-happy bad iye-wrong ibulala abantu. Yeah. Futhi iyathathwa nokuthathwa.
I'm sure we are all familiar with this image from a high school where young people were found with vapes. These vapes look cool and desirable. Our young people are being targeted. That's why the Department of Health's proposed tobacco control bill is so important. The tobacco industry and its associates have thrown everything at this committee. Take, for example, Professor Konstantinos Varsalinos, who presented to this committee. He declared he had no conflicts of interest, saying, I do not consult, work, or have any other association with any industry in tobacco, e-cigarettes, etc. This is such a big lie. Professor Farsalinos has constantly argued that e-cigarettes can help people quit smoking, but who is funding his research? He admits an association called AEMSA funded his research. So who is AEMSA? They are the American E-Liquid Manufacturing Standards Association. In other words, an e-cigarette manufacturing association. But it is even worse than this. Professor Konstantinos Varsalinos told this committee he had no links with the tobacco industry and e-cigarette industries. Yet, the University of Bath pointed out that Professor Varsalinos frequently co-authors papers with Konstantinos Paulos and the No Smoke Institute, which is funded by Philip Morris funded front group called the Foundation for a Smoke-Free World. The No Smoke Institute's academic papers list many as authored by Philip Morris, British American Tobacco, and Altria. We are a small NGO with limited staff and funding, so we couldn't fact-check all the presentations given to this committee, but we are certain that many other industry puppets presented to you, claiming to have no ties to industry. We cannot afford to have our democratic processes eroded by actors who profit from harming our society. Members of Parliament are elected to serve the public interest, not protect big business profits.
We currently having the Tobacco Products and Electronic Delivery Systems Control Bill in Parliament, which is a critical step to regulate all tobacco and nicotine products comprehensively.
Over 12,000 people have stood in support of banning smoking in public places, plain packaging and graphic health warnings on packets, and for e-cigarettes to be regulated the same as tobacco. Thank you so much, committee members, for listening to us today.
Yes, Palisa and your team, you have actually given us some of the shocking revelations. I don't know how, when you reply, you can actually confirm what you have said about the that professor who came and met us here. And but anyway, it will come from my questioning. Thanks for now. Let us open up for honorable members to interact with the presentation that has since been done. Let me recognize the hands of honorable members, starting with Honorable Van Staden. Number 2, Honorable Dr. Leroux. Number 3, Honorable Kumalo. Keep your numbers, Honorable Member. Number 4, Honorable Silne. Number 5, Honorable Chirwampungose. Number 6, Honorable Shabangu. Number 7, Honorable Zungula. Number 9, Honorable Mutubaze. Number 10, Honorable Dr. Letlape. Number 11, Honorable Mare. Maximum of 3 questions, honorable members. Thank you very much. Keep your
My hand
numbers.
is up, Chair. My hand is up, Chair. I don't know what's happening to this gadget of mine.
No, it's never up. Your gadget is not able to raise a hand. So you will come after Honorable Mare, will be number 11. Honorable Mare, thank you. Start, honorable members.
Can Chair repeat the numbers? I think he jumped one number just to ascertain us.
1, Honorable Van Staden. 2, Honorable Dr. Leroux. 3, Honorable Kumalo. 4, Honorable Silne. 5, Honorable Chirwampungose. 6, Honorable Shabangu. 7, Honorable Zungula. 8, Honorable Mutubatse. 9, Honorable Dr. Letlape. 10, Honorable Mare. And 11, Honorable Klerko. One after the other members. Thank you.
Thank you, Chairperson, and thank you to the presenters for your presentation. My 3 questions to you are the following. The first one is, do you have any scientific evidence that can support your views on this matter? You have made many allegations regarding professors, which was before this committee. So I just want to know if you have scientific evidence that can support your views. My second question is, do you believe that the illicit trade in tobacco will worsen under new legislation? And if not, why not? And my last question is, what have you done on your part to address the illegal trade in cigarettes and tobacco in South Africa? Thank you, Chair.
Thank you, Chair, and thank you very much for the presenters and their presentation. It's appreciated your perspective. I just had a few questions around the illicit tobacco trade. You said that there is no evidence that stricter regulations push people towards the illicit tobacco trade, but there's clear evidence from many countries all over the world that this is the case. So I just want to understand why you say there's no evidence, because I feel that there's fairly good evidence, and we have a particularly large illicit trade. And so I was just a bit surprised that you I think that it's has a significant impact on what we do, and it has a significant impact on our ability to control and reduce the harm of cigarettes, because when cigarettes are more expensive, people use them less. So I just wanted to get your comment on that. And then I think the second comment is, do you think that there's any space for harm reduction approaches espoused by countries like Sweden, that there should be a differentiated legislation in terms of the other non-combustible tobacco products? Thank you very much.
Thank you very much, Chair. Let me start by welcoming and appreciating the presentation from Amandla.mobi. I'm just having one question, Chairperson, in relation to the young people of South Africa, to check whether do they support the use of vapes, including those who were not smokers before. Are there any opinions on the easy access of the traditional tobacco and new generation products That is my question, Chairperson. Thank you very much.
Thank you, Chairperson. Let me thank you, Amandla.mobi, for amplifying the voices of ordinary South Africans, especially young people and vulnerable communities. As administrators of this platform, reading the people's sentiments, what is your opinion on not allowing sales of all these products online as suggested in the bill? And when reading the comments, again, do you get a sense that people are using these products interchangeably or dual use? Thank you, Chair.
Thank you, Chairperson Ngibulise futhi, to colleagues, and also to thank Amandla.mobi for their presentation. I think their sentiments are quite important, Chairperson, because I think we're sitting with a semi-crisis in terms of evidence and its flow, right? Especially in relation to vaping, to illicit cigarettes, and there's almost like and I'm sure the committee will agree, like an interjection where the evidence that goes in one direction, there's more evidence that goes in the opposite direction, to the other speaking against each other, right? And I think it's ordinary for a season where, especially in relation to vaping and vapes and e-cigarettes, where we don't have enough time, we don't have enough data sitting with us. And I think in the previous meeting that we had, we even raised this particular point. There was a time when smoking was considered safe, that even their packaging and marketing, you'd see pregnant women smoking, only to find out years later that some developmental delays and cognitive issues were later picked up from women who used to smoke while they were pregnant. And I think we're sitting with the same issue currently in relation to vapes. And I'm saying this in relation to the issue or the conversation of it is safer, or it's a safer alternative, especially with the contradicting evidence, even though not sufficient as is the evidence of that it is a safer alternative, it is also not sufficient. And I'll bring in the issue of illicit vapes, because I mean we're not engaging on it, but it's a situation that actually exists, right? With HopkinsMedicine.org having publicized the issue of the fact that 3,000 people were hospitalized due to illicit vapes and 68 deaths were caused. And this is a small study that was conducted during 2019 to 2020. So what I want to ask Amandla.mobi is in relation to the issue of vapes. What is their proposition and how we must confront this or deal with this issue of vaping? Should we continue with the bill as is and regulate across the board, or do you recommend an alternative? What would the alternative look like? Thank you so much, Chairperson.
Thank you, Chair. Let me also join my colleagues to appreciate the presentation by Amandla.mobi. And we really commend them for going out and getting the ordinary citizens' opinion in relation to the bill. Because if one listens to the comments and all the engagements that they were presenting, one can relate to the frustrations that it's experienced by non-smokers or secondary smokers. But I want to hear from all the hearings that they got. What was the opinion of those supporting the bill, if any, about 100% smoke-free laws for traditional and vape products? Did the comments point to the use of products by under 18 years of age, or if there's anything that they can give to the committee in relation to that? Thank you so much.
Thank you. Greetings to the presenters. What is your view on the Cochrane review, which finds that there is no risk of second-hand vaping and that vaping is less harmful than smoking? I'm asking this on the assertion that seeks to paint smoking and vaping in the same breath, especially when it comes to the harm and the inability to avail less harmful products. And then the second question is, would you perhaps give us a comment about the findings of the Royal College of Physicians, which in 2016 found that people smoke for the nicotine but die from the tar? And the last question is, what do you think this committee should or must do about illicit trade in relation to the bill? Would you agree that this committee has a responsibility to avoid instituting measures that would make illicit trade worse, thereby worsening the rate of smoking and basically going against the very objectives of this bill? Thank you.
No, thanks very much, Chair. Just from the emphasis of people who are supported, you were very hard on people who misled this committee. Is it your view that such people should not be trusted or be allowed to influence policy in our country? And are you willing to help this committee to further elaborate on some of the people who came to this platform and misled the committee in respect of their relations with other people who are outside? I would be very interested in having those people. Can you go further and help the committee and make such submission? If you do, I'll appreciate that. Secondly, you around. Would you agree that vaping is the biggest threat to smoke tobacco? And how does treating a single largest competitor tobacco, which has been found to be harm reduced, support public health? Are we not protecting smoked tobacco by continuing to put messaging that could be confusing smokers about harms of vaping and how this compared to smoked tobacco? Thanks very much.
Thank you, Chair. There's been a lot of emphasis around illicit and funding of others. Can you comment about the decline in revenue from SARS in relation to tobacco taxes and what is going to happen going forward in relation to that? Because there's the assertion that a lot of the illicit comes from the very legal manufacturers. So are we creating a bill that will promote tax evasion from people that were paying tax without reducing availability of product in the market? The second question is, I'm just concerned about the assertion where you're talking about the chair of this committee.
Yeah,
and I would like you to clarify that. And I just want us to be careful that you have the ability to defend the claims that you make about people, including the chair of this committee and others that have presented before. And I haven't had any questions raised about the science. So I just need to know from the studies that you've done and the questions that you've asked the public, are the public properly informed about the different nicotine products, risk continuum, and just thumping them together? What is your assertion in that? And if they have the correct perception, I guess there's nothing to do. If they don't, how do we ensure that people have correct information and how would that be disseminated? Thank you, Chair.
I don't hear number 10. I am number 11. Let me take the space, Chair. Good evening to you and everyone in the platform, Chairperson. Amandla.mobi, to you online platform. it means you don't only present your views, you also present views of individuals that use your platform. This is our first experience as the committee. But what I pick up is that your platform that you are using is assisting in this regard. But it would be better if you can share recommendations that are made in your platform. I've heard those that are in support, I've heard those that are against, but generally, I would like to know the age of those that frequently use that platform. I'm interested in understanding that. And also, is the purpose of the platform to get individual views, sharing information, and also having educational debates? How far do you go? Do the people that use your platform understand the bill? Is there a chance that they can be educated about the bill? Because I understand that you get more coverage as you are using an online platform, which I think people across the world are interested in your platform. Can the comments made, therefore, be categorized further or quantified according to similar views? If not now, can you maybe submit that information to say about this bill? This is how far people have commented, positively or negatively. I just wanted to raise that, Chair, and I thank you for allowing me the time to make those comments. Thank you.
Thank you, Chairperson. I just have these questions to ask to the young lady is that people, you said in your slide, people that want to stop but can't because it's not easy. I just want to know, don't you think that people have a choice to smoke or not to smoke? And then my other question I would like to know is what would you do in curbing the illicit trade? Because it is, you say that this is the problem of the police, no? Or I just want to find out, is the way that people are avoiding tax because of this illicit trade? Or do you think we must increase taxes on tobacco items? And then I would like to know, do you think that people prefer vape over cigarettes because you think it is less harmful? Or what is the reason that people are preferring these vapes over cigarettes? Thank you, Chairperson.
Yeah. We may not be able to avoid having some of these products, but we need to have them regulated. For the young people, maybe to indicate, we may have to decide. There have been some presenters who say vapes, there are those that are multiple use and they're single use. Single use, easily accessible to young people. Also, they have an impact which is negative on the environment. Maybe those ones should be not be allowed to be on the market and ban them. It would be important to share your views. You can't ban everything. There has to be certain things that will have to regulate and allow to be in the space. Number two, on this one, I think it is a very strong statement to say illicit trade has nothing to do with us. It has a lot to do because we are going to now hinder programs. Rather, we should be encouraging the department to also find ways to be closer to those people who are controlling SARS, Department of Finance, and everybody else, police. Because if you are putting yourself at a distance, you are going to find that there's going to be more and more resistance to this issue and say illicit, though we know the source of illicit trade, but department must also be able to, and all those who are pro this bill must be seen to be encouraging programs to curb illicit trade and not distance themselves away from it as if it has no impact. It may as well do have an impact. But the last one is a comment that you made, a very strong one, with regards to another presenter that came in here, not so much about the content of what the presenter made, because it's a viewpoint that you have and their viewpoint. But my concern is if you could just repeat what you said about that presenter in terms of the representativity and the interest there. I mean, the interest, the conflict of interest possibility when he declared this, that, and the other. That's very important to follow, because at the end of it all, when this committee actually collates all that, it is important to actually be able to say, yes, these views were correct and they were good, but they were brought to this committee by a person who was not honest, if that is what we need to investigate. What I could say on the allegations that you have made, I'm not able to conclude, but I'll be interested to follow this matter up. So maybe even if you are not exhaustive in your response here today, I would really want you to assist me by sending that information to the secretary of this committee, because we are dealing with a bill that is pro-health, and the bill that has a lot of other interest on the business people who won't want to see anything done on this bill. And therefore, the going forward of this bill has a lot to do with how we process it in terms of biasness. So we need to really be clear that there's honesty, there's integrity, and there's all those and morality and ethics that is following all presenters and ourselves on this bill. Thank you very much. You can give us your response. We will not give you more than 12 minutes on this one, please.
No problem, Chair. Thank you so much, honorable members, for all your questions. I just want to start by saying that we are not health experts or economists. And we are also not experts on the health harms of the economic impact. But what we are experts in is the concerns of the public, especially low-income Black women. So I've read every public comment that we have received, and it is crystal clear that people want stronger tobacco controls. And they also want members of this committee to act decisively and not to be tricked or used by vested interests. On the question of the chair of this committee, so we did not say that he has been captured. We are just saying that the industry got to him. They presented before him and he had to respond before them. But we are willing to provide further information to back our claims up. We will write to the chair of this committee. And then there was a question around, so there's been numerous questions around the illicit trade argument. And I think in my presentation, I did specifically write about the WHO and the research that they have done. So they note that, can I firstly start by saying that the illicit trade issue demands a holistic government approach, and we accept that. But we are saying it is not specifically your mandate. We are saying SARS and SAPS should be leading this discussion. And the tobacco industry has made the focus of these hearings on the illicit trade market and not on the health of the people to whom they are selling their harmful products to. Okay, I'm trying to keep track because there were just so many questions. Okay, and then to Honorable Chira and Honorable Vuyo, we are saying that vapes should be included in the bill and regulated the same as other tobacco products. While some of the liquids don't contain nicotine, many do, making them no less addictive than cigarettes. As well as inhaling the aerosol from these vapes, we know that these can cause lung damage and heart problems. So on the issue of the person who misled this committee, we are saying we are willing to provide more from our presentation. And as stated, we didn't cross-check all the public comments that the committee received because we are a small organization. But from the small information that we saw that he lied to this committee, and we can back that up. And then people obviously do have a choice to smoke, but we need to encourage them to do better for their health. I think those are most of the questions that I noted down. I hope I answered all of them. Thank you.
Hayi bapha abanye abakuncede. Are you done? Not so quickly.
Yes, I have done. Sadele, do you want to come in? But I'm done. Thank you. We will write back to the committee.
You will do what? You will write.
Yes, we will write. So I noted down all the questions and we will write to the committee with all our evidence.
Okay, we must have scared you. Did we scare you? Okay, no, that's fine. All right. I don't need to push you too much. Please do write. And I had requested you specifically to comment on what you raised. Of course, I don't think you could be able to provide that now concretely here, but I would be interested to read and see what you are raising. Because as we are wrapping up, we are going to go towards closing this bill in a form of a discussion amongst ourselves. So, if we need to really get some of those things being brought to our attention, that would be great. Thanks, Palisa. Okay. Okay. We thank the young people who have made it to this meeting and have been able to present themselves and their cases that very well. Now, Miss Machalamba, there was a Mr. What was this other one? Another youth team that was supposed to come in.
Marco, Pheli
They
Youth Chair.
they had a
Pheli Youth
challenge.
Conference.
Are they able to log in now?
Yes, I am here, Chair.
Pheli, okay, Pheli Youth Conference Forum. Please be given sharing rights. You start now at 5:10. At 22:06, we would have finished with your 30 minutes, and then we will start with the members asking you questions, and that must also be supported by responses of not more than 10 minutes thereafter. Okay. Your 10 minutes, your 30 minutes starts now. What about 9 minutes past 5? Thank you.
Okay, thank you very much, Chair. As it is said, my name is Tato Marco. Yes, and then I'm the chairperson of the Pheli Youth Conference Forum. And today I'm just going to be very short because a lot has been said, and I concur with all people who are there to support those who are already hooked and to ensure that nobody starts smoking or even attempt to vape. What is Pheli Youth Conference Forum? We are based in a township, so there's a township called Pelindaba, which is in Attridgeville, Sourceville, and Lotus Gardens. So we are based in a township and informal settlement. We are a youth-led organization with the purpose of ensuring the unified youth in and within Pelindaba. So our most can you see my presentation, Chair?
Yes, we can see your presentation. That's why we are fine with you. Continue.
Okay, thank you.
Mm-hmm.
So
from Attridgeville, From Attridgeville.
Yes, where the Minister of Electricity comes from. Yes, that's where we are from. So what motivates us as young people in Attridgeville is that we need a united youth that is actively on the ground advocating for equality on health, politics, economics, and all social services. Therefore, that is why today we are saying our organization is here to completely support this proposed law. So we support this bill for many a number of reasons. So one of the reasons is that this novel nicotine products, such as electronic cigarettes, have found their way into the market already, and it looks like they have found their target markets as well. But unfortunately, the aggressive marketing tactics employed by the tobacco and nicotine industries attract non-smokers who are most young people, and they contribute to harm of society. And the more these people initiate in terms of smoking these products, we all know that there's a moral decay right there. And then we understand and we believe that nicotine products such as e-cigarettes are used to normalize smoking and glamorize nicotine intake, smoking conventional cigarettes, and drugs as well, and must therefore be regulated along with conventional cigarettes. And I'm going to show one of the reasons why these products must be regulated in the very same bill. So our main focus now is that we need to control smoking. And why are we saying there should be control over smoking? Because we as young people, we are in solidarity with, I don't know, are my slides still showing, Chair?
It's just that they are not moving. I don't know
But they
whether
are
it's
moving from
moving.
my side. Let me.
Yeah, all I see there is the first slide. Yeah. Can you do this? Can you, if you have a laptop, go there and put Pheli on a slide, what they call it, that hourglass thing at the bottom, which
Is
will
it
then
showing
put
now?
your slide. Not yet.
But do you see my screen now?
It's still blank. I don't know whether it's me only.
Let me.
We can't see anything.
Let me recheck and start from scratch.
I thought Pheli, it's young people who are very good on IT. It's only the older ones like us who struggle. Now, don't disappoint me. Don't struggle. Go there on that presentation now. Yeah, hold on. Go there on the bottom of your slide and press that hourglass thing. Yes, then you are correct. Then keep on moving. Hey,
Thank you very much. I was sharing the wrong
teaching the
screen.
youth now. I'm teaching the youth. I'm proud.
Yes.
Go on.
So we are saying we need control over smoking, and this is why we need control over smoking. We need to ensure that as much as we are in solidarity with workers and non-smokers, advocate for the health and rights of all employees in the restaurants. And I'm going to give practical examples because I don't live in an estate. I live in reality in a township where there are a lot of people who work in restaurants, whether they are pregnant or not. There are people who work in pubs. So the research that cannot be argued, which is not a left-wing or right-wing conspiracy theory, but a widely known and accepted fact, is that secondhand smoking is also harmful. And that's why we need 100% no indoor smoking. Why? Because the people who are working at restaurants who are non-smokers, or rather even those who are pregnant, they still need to go and serve in those smoking areas. And then they inhale that secondhand smoking. Except for that, the World Health Organization has proven with facts that there is what we call the third-hand smoking, which is inhaling of particles when the smoker is no longer there, the smoke is just on the surfaces. So we need to ensure that we do not neglect those people simply because they work in restaurants or any other low income field. So the workers' rights we must ensure that they are always protected because they can't be compromised. Most of these people who are exposed to this secondhand smoking don't even afford medical aid, and we cannot argue the fact that sicknesses that are caused by tobacco are most expensive to treat. We can't argue with that unless there is a new research that is made. And we need to also ensure, because when we control this smoke, and ensure that these young people, or rather a worker or anybody, does not inhale these products and become harmed by these products. We looked at the section 24, paragraph B of Bill of Rights, which guarantees the right to clean air and a healthy environment. We cannot, the Constitution is the mother of all laws, and it is a superior law, which I don't believe any law that contradicts it is consistent with South African and its objectives to protect human. So we must also ensure that, Chair, we control the marketing and all kind of advertisement. There is this thing. There's a term we call in-store marketing. The in-store marketing is a term that we must understand that it is a marketing strategy that is used to lure people into seeing a specific product in a store, simply because the purpose of marketing is to promote a product and make it look much better and appealing. That is the purpose of marketing. So when we do banning of point of sale advertisement and marketing, it means we are discouraging demerit goods. How so? Because it will reduce the use of harmful products like tobacco. People might ask themselves, but how is not marketing something reduce the use of harmful products? It's simply because if you are not telling someone that we have this product, it's nice, it looks good, nobody is going to actually think of consuming that product. That's why when a business is not moving in a specific field, people feel like, no, we need to market this product. Chairperson, that's why even today, you see famous restaurants being advertised on TV, on radios, on newspapers, on social media, not because they don't already have customers, but because they hope and believe that there's somebody who has never consumed their product before who would wish to then try and consume their product. So we cannot say that the tobacco industry must market or be left to have an in-store marketing simply because they must raise their products. They are not selling consumer products. They are selling poison, for God's sake. They are not selling any product which is beneficial to anybody, whether health or it doesn't even make you full when you are starving. So it is not something that we must negotiate. We must completely ban that marketing. So we also ensure that banning of this point of sale and advertisement to protect children, because cigarettes are often placed next to candies and chocolates in local shops. It attracts a lot of children, and the setup is trying to normalize the smoking and sparkles curiosity amongst young people. And I'm going to show you in this presentation, Chairperson, what I am talking about. If we look at this on my left, on our left, there's an in-store. This is a store that is closer to me. It is where my son goes to buy a chocolate every time he cries for a chocolate. Look at what these people are depicting there. That is not responsible marketing. No parent can take such things and place them there, because it's sweets, chocolates, and drinks that are placed there next to cigarettes. And they're doing this so that it can become appealing. Look at how clean that setup is. And it is enticing. There are colorful vapes there. There are colorful cigarettes there, which a child by nature is going to be curious. That's why this is a behavior issue. Smoking is a behavior issue, and a behavior, according to classical holistic researches that were done, this behavior of kids, more especially adolescents and the little ones, it's actually sometimes led by attraction. When they're attracted to a specific thing which they are used to consuming. For example, if you give a child a juice there and a vape, they would simply smoke that vape because they think those flavors and that juice, there's no difference. because you cannot shy away from the fact that kids like exploring things and they are curious. So, Chairperson, on my right, if you look at this image, I took it from a local garage where I stay. That local garage already has those things with timeless thinging on them. Inside there are cigarettes. Chairperson, when we say banning of point of sale advertisement and marketing, we're saying we remove this kind of placements on my left and replace with the kind of product placement on my right, which is already in existence, but we need to remove those colorful things and the timeless thing there. Only that you cannot sell products to anyone under the age of 18, and also graphic health warnings, and also danger tobacco smoke causes diseases. Those are simply things that are implementable. Everybody, for brand's sake, everybody knows if they smoke cigarette, what brand they're smoking already. Unless we are saying that we want people to start. Those who start actually want to explore all of them. But those who already smoke already know when they go to a store, give me this and that. Same as when they buy a single stick cigarette. They don't say, what brand do you have? They still tell you, please give me 2 of this cigarettes type. So this is something that is enforceable. So we are coming to the issue of plain packaging. Actually, you will excuse me for saying plain packaging because the bill says standardized packaging, and everybody understands what a standardized thing is. When we say standardized packaging, it simply means packaging that is recommended and is as standard as possible, and with graphic health warnings on tobacco and nicotine products. Because most people who are smoking today started smoking when they were children and adolescents. We cannot argue with that. It's a simply known, widely accepted fact. I live in a township. I see kids every day who come out of school. They smoke everywhere, and most of them don't even fear that there's an adult who's going to come. It's not like the olden days. Now this current packaging that attracts kids, and more especially these vapes, because whether we like to accept it or not, this thing of vapes has been there for 15 years, and people are saying that it is a tool for harm reduction or something, at which I fail to understand what harm has it reduced for the past 15 years, because the same social behavioral pattern has been continuously showing to that endangered characters and endangered behavior still continues to rise in our country. We understand that adolescents are curious and they want to be cool, but now it's no longer about them smoking. It's about who has the coolest device that has the coolest flavor, Chairperson. So, Chairperson, here again on in terms of standardized packaging, if you look at my my left, Chair, you will see I took these photos with my own phone. That's why they don't have quality, because I use my own phone. This was a school search in a Sweerdeberg Special School. We found kids with vape products, with a lot of them. And when you ask them, they say the flavor, they are going to talk about how nice the flavors are. So what harm does it reduce? Because it lands in the hands of kids. So we are continuously arguing about an obvious fact that, Chairperson, a doctor does not need to consult a mortuary owner before they can treat a patient. So it's like we are trying to be humble to the mortuary owner, so that maybe they don't feel offended. If we have to treat a patient, let us treat a patient and stop diving around the bush. So children in that school are saying that this can be harmful simply because of the packages that are on these things. And these are people who are in the school, in the township. They are not living in estates or suburbs, Chairperson. These are people who are facing everyday reality. When it's time to starve, they are the first people to starve. When it's time for other political unrest, they are the first victims of these things. Now they became the victims of these very same products that are being defended by everybody. And in terms of that, Chairperson, somebody can say they give example from America, wherever they do. Why don't they give example about Singapore? Because Singapore has already banned this thing. So it looks like there are people who are going to argue in and using something that favors them, that is favorable. And then a matter of fact is that in South Africa, nobody is trying to say nobody must sell this product. But then these products must have a standardized packaging with graphic health warnings. Yes, if they think these products do not cause cancer, if they think, because that's thinking, it's not scientific, if they think these products do not cause sicknesses, then whatever it causes, it must be written there as a warning to say that this causes this. And if they're saying it's harmless, they must say it's harmless. They must not say it has a lesser harm, because whether you are throwing a grenade at someone or shooting a pistol at them, Chairperson, is the same thing. You are killing that person. And then in terms of on my right, Chair, you see there's a brand called Nasty there. If you can look at this picture, I took it from the same garage that is next to me, at which these are Nasty products. They are vapes. You buy one of those vapes, they give you a high caffeine content called an energy drink there. It's a promotional thing and a brand stretching. Why do we need, if this is for adults who must smoke less harmful things, why do they have to convince people? Why don't they convince people based on research? So in the meantime, while they're still waiting for a research, we cannot risk losing people's lives because people are still thinking of whether they are a consumer product or a health product. We need to regulate them. So, Chairperson, on this slide, again on plain packaging and graphic health warnings, if you look at my left, I took these pictures with my own phone again, and I do have this in physically. I had gotten this in Ethiopia during training. So this is the industry, the same industry that is crying in our country. They are complying in Ethiopia. And Ethiopia has about 3.4% smoking prevalence. So it means this will change the social behavioral pattern and it will reduce the smoking prevalence that we are talking about. Not products that will actually ensure that people continue to smoke, because it doesn't matter you're consuming it doesn't matter you're consuming a nicotine at a low range or what, but Exala, your chair, this is what the industry is doing. They are complying in countries that have these laws. They don't want to comply in our country. And most of these companies are from British, America, they are from Japan. They are not South African, and they want to destroy the lives of people in South Africa in the name of employment. And that one of employment can be addressed, and we will address that issue of employment, because we are not lazy to even think of a way to creating jobs for the people of this country. And on my right-hand side, Chair, if you can see, majority of South Africans, especially those who are poor, and I'm talking about the reality that I see, because people are buying single sticks, most of them here next to me. Chairperson, if yes, I believe that yes, although although selling single sticks is going to increase a number of people who smoke, but if somebody wants to make a choice that they want to smoke if they're adults, Chair, but it can't be because there are no laws to consistently remind people that these things are harmful. It will be their personal choice simply because they don't care about the message. These are the single sticks, how they should be. If the industry say they still want to continue selling single sticks, the single sticks must have these graphic health warnings. It's already happening in Canada, Chair. this is possible. They must just write them there if they want to continue selling single sticks. And I'm based this on reality. So, Chairperson, hookah pipes, they are glamorized, these things in society, more especially on social media. If you look at the picture on my left, it says peer pressure, serious relationship, it will bolaya batho, tsubang habli. This implies that, to those who don't understand the Maekasi language, it says that peer pressure of serious relationships will kill you. So rather you smoke humbly. This is not the lifestyle that we want for our South African kids. And on my right-hand side, Chair, you see it's the same social media handle that says it implements challenges based on who has the coolest flavor or the newest flavor in the market. So, Chairperson, it's simply because most people don't believe these things are harmful, and they will believe when they have graphic health warnings on them, Chairperson. The issue of illicit tobacco in the township, it offends me for the industry to blame people in the township for this illicit, because most people who stay in the township and informal settlement are African. This offends me to even think that the same people who are saying that are talking on behalf of Britain and America and Japan or those other multinational tobacco companies. Here is an article, Chairperson, by the Citizen that says, Go Live Tobacco denies tax evasion, blames British American tobacco. So are we going to say now we blame the Department of Health, or we want to discuss this issue without law enforcement in it, while the industry is playing cat and mouse against each other and playing their spy tactics? Chairperson, the same industry, most of them took stars to court for wanting to place CCTV footage cameras in their manufacturing store, saying that they don't want it. Why? Because the very same people, Mr. Francois van der Merwe, has proven with facts and said that the same mainstream tobacco companies are the ones that are flooding the streets with illicit tobacco. And I can retrieve the very same clip from public hearings where he says that exactly. He further came and said it here on this platform again, Chairperson. So, Chairperson, in conclusion, you must know that delaying this bill further kills the society. And dear MPs, please, you must put the life of our people before profit, because health is wealth. And I want to also try to address a specific issue. Chairperson, we understand that there are a lot of people who might believe that things like harm reduction means reducing harm and all that, but it is not actually. So I want to understand something very important now. Why would we want to prioritize smoking? Because if we say that people need to stay away from demerit products, the government says people must stay away from demerit products. Why can't we encourage people to continue buying fruits and veggies with the money that they have? And it's interesting that the tobacco industry and some of its spokespersons say they want to be regulated, but they are against the content of the bill. And I don't know, did they want to self-regulate and write a bill of their own that suits their own profit? I've never seen that happening, Chairperson, and we can't be reluctant in addressing these issues. And in that regard, thank you very much.
Okay, Honorable young leader, just drink water while you are getting pen and paper.
Will do, Chair.
Question.
I have the water, Chair.
in this order, honorable members, Honorable Chirwa, 1, Honorable Van Staden, 2, Honorable Kumalo, 3, Honorable Sine, 4, Honorable Totalitape, 5, Honorable Dr. Leroux, 6, Honorable Shabangu, 7, Honorable Zungula, 8, Honorable Mare, 9, Honorable Mutubaze, 10, Honorable Treko, 11. In that order, honorable members, keep it to 3 or less.
All right,
Start.
ngiyabonga Sihlalo. Greetings. It's so encouraging deliberating on this bill, especially because it's young people. My name is Nelly Chirampungosa from the EFF, and this is my question. Bill is sufficient in regards to encouraging prevention? Like, is this bill in its current form enough for the issues that you are raising as a collective to say no? And this bill must continue. But now I want to find out from you, Hori, if this bill is sufficient to address those issues. And then number 2, in regards to enforcement, because we know bill, molao. And then you'll find that even if bill anything, but there is no enforcement consequences. I'll give an example. Like for instance, tabaya discrimination and racial prejudice are issues that are covered in our constitution. But you'll find that one company, for example, that still pay black people less or pay black women lesser than their male counterparts, right? And there is no consequent management in relation to that. Like companies don't get to pay money or be criminalized because this particular right is not protected or this particular right is being acted against. So I want to find out from you as the use of Pheli, Hore, what should be the consequences of retailers, the manufacturers, in relation to this bill in particular? And should we add these consequence management to this particular bill? Thank you so much, Chairperson.
Thank you, Chairperson, and thank you to the presenter for your presentation. It's much appreciated. Many years ago, we had advertisements of tobacco products and cigarettes on TV and on radio, in the movies, in the magazines, everywhere you go. But then law came into place and banned those advertisements, but it didn't really help people to stop smoking in this country. So my question regarding to that is, what will this bill be any different? If people want to smoke, they will smoke. They will make a plan to get hold of these tobacco products and cigarettes. My second question is regarding, and I think my colleague before me just also touched on that, and that's the enforcement regarding legislation. Regarding the offences and penalties under clause 16 of this bill, do you think that we as a country has the necessary manpower to enforce this legislation? The reason I'm asking this question, under the current legislation, you can only smoke in demarcated areas. In most public buildings, you cannot smoke anymore. When I was a young guy, people used to smoke in public places, in public buildings, but that is all banned now under the current legislation. And my last question is, sorry, my papers is gone now. Regarding the penalties, do you think that we have a necessary manpower to do that, to enforce this legislation? And do you believe that the illicit trade in tobacco will worsen under new legislation? And if not, why not? That's my questions. Thank you, Chair.
Thank you very much, Chair. Chairperson, let me take this opportunity once more again to appreciate and welcome the presentation from Pheli Youth Conference Forum. I want also Chairperson to commend them for supporting this bill and standing up for the young people in their community. I'm just having only 3 clarity questions, Chairperson, that I want to ask. One, is there anything that can be added to the bill to strengthen it, to help prevent youth from starting to smoke or vape? You mentioned that nicotine products should be regulated similarly to conventional cigarettes. Similarly, in what way? Why is it important for South Africa to regulate tobacco and emerging nicotine products under a single legislative framework? Those are my questions, Chairperson. Thank you very much.
Thank you, Chair. Thank you to Pheli Youth Conference Forum for your valuable presentation. Like I said with previous presenters, it's really encouraging to see young people fighting for the youth of South Africa. It is important that young people actively participate in shaping the laws that directly affect their health and future. Chair, what is your view on what other presenters have said, that the bill will have a negative impact on the jobs for small farmers and also for businesses? I think you actually touched on that one, where you don't care about the jobs. But what is your view? I just want to know if you can just unpack in detail your view. And also, what role do you think the youth-led organizations should play in monitoring and supporting the implementation of this bill once it becomes law? Thank you, Chair.
Thank you, Chair. Let me appreciate the presentation. Firstly, the presenter spoke about Singapore, making a reference to how Singapore is dealing with the issues of tobacco. Can the presenter maybe explore how the differences between Singapore and South Africa in a context of law enforcement, and how, when we deal with the problem in South Africa, we need to be circumspect of the prevailing circumstances in terms of the environment of law enforcement? One would understand that we can't make laws as if we are in another country because the environment differs. So is the presenter alive to that reality that when we make laws as a country, we need to take into account the health, public health, we need to take into account the socio-economic environment, and take into account other prevailing issues that may impact public health, which includes illicit trade. Then the second question is, in a township setting, how do you see the restrictions on public space smoking working, given the apartheid special planning and congestion? And would you agree that in the current format, given how the congestion is when it comes to the townships and informal settlement, the bill as it is, if passed, it would victimize Black people or Black communities? And then the last question is in regarding the issues of science. Would you agree that we're dealing with something or an issue that needs scientific evidence, needs to be driven by science more than anything? And the question of harm reduction is also backed up in terms of evidence when it comes to science, to say you've got products that are less harmful than others, and therefore those products would somewhat reduce the public strain on the health if people take up or if people move from the more harmful products to the less harmful products. Whilst I get your assertion about the issue of a grenade, that a grenade, whether it's a gun, it's a grenade, when you kill someone, you kill someone. But in practice, here we're dealing with smokers who, some of them, they are struggling to quit. It's not that they want to smoke, they are struggling to quit. Therefore, they must be protected by the Constitution in terms of being availed alternative products that are less harmful than others. What is your take on that? Thank you.
I'm number 7. If number 6 is not coming in. Oh, sorry,
Yes,
Dr.
coming Shabangu, if he's not coming in.
Is it me now, Chair?
No, Chair. I can't remind colleagues all the time. Just note who are next. It's Dr. Letlape. There are colleagues I must remind all the time. No, I can't do that. Just note where you are. After Dr. Letlape is Honorable Shabangu.
Thank you, Chair. My first question is, you know, we some of us also come from the townships. We might not live there permanently now. Are people able to make decisions for themselves? And if they can, how do we inform them so that they can make decisions? The second question is, as a parent, you know, we have a problem of non-communicable diseases, and sugar is part of the problem. And when you get into stores, there's sugar all over. You've spoken about your neighborhood and your child. What is your responsibility as a parent to your child? And if your child used nicotine through cigarettes, what would you advocate as a parent for them to do? Because some of us, we're parents, and we have children that have nicotine dependence, and I'm just interested in what you'd provide them. And just to say to you that harm reduction is a well-known concept in healthcare, and it involves society. It's well established. It's not an invention of the tobacco industry. Why, in your opinion, should it not be applied to those that are being harmed by tobacco products? And we know that cigarettes are the most harmful way of getting your nicotine. Thank you, Chair.
Thank you, Chairperson. And
Chair,
let me also...
I'm just sorry, I lost my hand, and I seem to remember that I was meant to be after Dr. Letlape. I don't want to interrupt the current speaker, but
I'm number 7, Dr. Leroux. I'm after Dr. Letlape.
Okay, I can speak at the end then, but I was told to speak after Dr. Letlape, but that's fine. I'll let you go next, and I'll speak at the end.
Thank you. Thank you, Chair. Let me also appreciate this presentation from the young people. You know, it's also very much inspiring to hear the young people debating the issues and getting involved in this the proposed bill. And I like the tone which says nothing about us without us. We want youth that is involved, that is participating. We really appreciate their input. But from the present, I think you will understand that this bill it's not proposed to ban. We are here to try and strive the balance. So some people argue that the bill is against personal freedom. What is your opinion on the people's right to choose to vape or smoke versus protection of non-users? Because that is what it's emphasized on the bill. But I want to get your opinion on that, because it's more, we are protecting the induction of the, I mean, we're trying to reduce the induction of the youth to smoking, but with all these colorful vapors, which is targeting the youth, it seems to be working against this proposed bill. But I just want to hear your opinion with how can we achieve the balance on this, the smokers, non-smokers, and protecting those that are not smokers, actually to prevent all these critical diseases that are caused by smoking. Thank you, Chairperson.
Chairperson, I'm number 9, but
Honorable
it seems like number
Mare,
8 is having a problem.
Honorable
Yes.
Mare come through. And then after
Okay.
Honorable Mare, it will be Honorable Teko, then we complete with Dr. Leroux. Okay.
Thank you, Chairperson. Chairperson, I want to say thank you for this input today. It's very eye-opening to listen to young people that is having a passion and the way they are speaking about the care for the community. But I want to understand is, I think COVID-19 has taught us a big lessons. If we talk about banning, even though there's banning, people still got cigarettes during the COVID time. If we say there's laws in place, people are still going to break the laws. What are the gentleman's view about that? Because he is very passionate saying that we must stop the smoking things. And if you look at the township, a lot of people are smoking cheap cigarettes, vaping. That's why I say the vaping is expensive, because it's come from 90 Rand to 100 Rand, 120 Rand. And then people take the cheaper one day and they smoke the 20 Rand cigarettes, because that is what they can afford with the unemployment rate that is so high. So I just want to understand, what is the view of the presenter about that? Is it because smoking is more harmful than vapes, and because vapes is sometimes unreachable? And then also my question that I want to ask is that, see that the gentleman is so passionate about this coloring, the colorful packaging of the different flavors and things. We see even in the cannabis shops, they are selling the jelly babies and the snakes and all those things. That is, that is for children. That is for children. So I just need to understand what is their view about that also, because we all have our interest of doing things and doing it differently. But when it comes to the children, there's a lot of harm that's lying out, because people think it is nice to walk with the vape and all these things. But where are we going to pull the line between harm that's harm, and then saying, okay, vaping is making it less harmful? What do the presenter feel about that? Thank you, Chairperson.
Thank you very much, Chair. Good evening to all. Chairperson, I must first commend the commitment displayed by young persons today. There's been a lot of young persons presenting today, and they seem to be understanding the purpose of the bill. They understand it as a protection of public health, nothing else. And I appreciate that. That makes me to believe that a smoke-free South Africa is possible, given the confidence and the knowledge and the understanding that these young people are having. Chair, I can hear it was just a comment that, but I have a question regarding smoke-free spaces in South Africa. Should these smoke-free spaces, should the laws that we intend to apply also to vapes, including e-cigarettes? If yes, why? Also, I had a concern around the input that is always made by other presenters that always say the bill that we are entertaining will severely impact on the hospitality industry and tourism. But the presenter has responded to that clearly. I am satisfied with the input regarding that. The question remains the one that I put as the one on vapes, if we must include vapes and e-cigarettes in one legislation. Thank you very much, Chair.
Well, thanks.
Honorable Dr. Oh, there's Honorable Mutubatse before you. You are the last one, Dr. Leru. Mutubatse, sorry.
No, thanks very much, sir. Pardon me, I'm in a very unfriendly place, but I'll be quick. Just from the presentation that was made, you seem to be gravitating towards banning, and this is not the intention of the bill. What is your view on harm is harm? You seem to be banning itself. But don't you think that when we ban, that will increase illicit production or illicit trade? And second, you have spoken around what you have experienced in your neighborhood. What has been your role in advocating this bill or making sure that young people are aware? We are all impressed today by the fact that a lot of young people came through. But what is the percentage? How far did you go to cover the ground? And what would you suggest that you should do moving forward as young people, as it affects most of the young people in the townships? Thank you very much.
Honorable Dr. Leru, yes, yeah.
My apologies here. I wasn't. I thought it was Claypool who would be last. Thank you very much to the presenter, and thank you for your passionate presentation. I appreciate your advocacy for your community. I just have two questions. I be interested. I mean, it is an unusual topic to be dealing with as a community organisation, and I'm just interested why this is something that you felt passionate about presenting. And I'd be interested just to see who you're funded by. And the second thing I wanted to ask you was just, I wanted to get your perspective in terms of the enforcement of this this bill. I think that there are quite strict rules that are there. How do you feel? Do you feel that this is enforceable in your community and in areas? Do you think this is a priority, or do you think that it will be difficult to enforce? Thank you very much.
Okay. Thank you very much. I just wanted to check, firstly, there's something that you need to educate us about. I was not aware that there's something called second-hand smoking. I always know that if you smoke, you get exposure to those who smoke, and if you don't smoke, they expose you to the smoke. Now, today you're educating us about the third-hand smoking. Please explain that a bit more. I really want to know this much more. But I think, like Honorable Kleko, this bill really is futuristic about the young people, and I'm glad to hear so many young people's voices today. This bill is saying, it's asking them to take a lead because it has an impact on the young people. Sometimes by the time you see the impact of this bill, some of us will probably not be active in anything because it is not meant to be for us. I just want to quote, yesterday I was exposed to another very good professor, is a comment, Professor Francis Omwasa is a former Director General of Department of Health in Uganda. And then he's really commenting, he says, health is made at home and only repaired in health facilities when it breaks down. Now, I would want to really say, do you see your role also advocating and strengthening the mobilization of young people so that they probably don't start? Because you are going to then help me to come to this statement. There's a statement made by some other presenters. They said, if you don't smoke, don't even start. But if you smoke, please quit. Tato, give us a space to allow those who are struggling and they're not able to quit to say what you do offer them to assist them going forward. I think it would be important that we touch on that because there's no country in the world that can really be, in Sweden included, there are 5% less in terms of being exposed to smoking. And therefore, they are probably getting their citizens not to stop them to smoke, but to actually encourage them to do other things, which I would want to hear that even though you may not be believing in that, but let's actually be in the real world that you may hope to have for young people, advocate for less and less, or even not to start. But for those of us who are already there in that pool, how do you continue to support them so that they could still be able to move on with life despite that and probably less effects? And therefore asking you to really have a role in terms of differentiation of these processes. Please respond to these questions, but don't take longer than 12 minutes, please. Rearrange your time. Thank you.
Yeah, thank you very much, Chair. There are so many questions and I have so many answers. I will try my best to answer. And if I fail to answer others because of time, I will write back to the committee answering these questions. Thank you very much to members because I see their interest in my presentation and I would like to applaud you for that. And let me first start by saying we have a problem as a country and we can't shy away from it. And if we have a problem, it needs to be addressed. The first thing that I want to say, I grouped the questions here, but the first thing that I want to say is that pawns only move a square in the game that they used in, but realize it too late. So I would like to say that the issue of law enforcement, they're saying that Singapore law enforcement and South African law enforcement are not the same. I gave Singapore example, Chair, simply because the committee has accepted evidence from Sweden and other countries. Why is it that we're making exception? Is it because there are some people who are biased to selective information that they receive and the other countries, they don't care about what they do? But that is a very political thing, which I don't want to dwell much in. And also,
Honorable Tato, wherever you are you able to show your video?
Okay, yes, I am able to. Let me.
Yeah. I also would like to request honorable members, I've been informed by the staff that we are on Parliamentary TV and therefore they would like to see, they are screening this presentation live. And therefore, if you are able to show your pictures, honorable members, when you ask questions, that would be appreciated. Thank you very much. Continue, Tato.
Yeah, thank you very much. I was also saying the question around law enforcement. Thank you very much. I believe that in international experience has shown that enforcement of these laws is very much possible. Let me take, for example, and it also goes back to the question by Honorable I nearly said Steenhuisen, Van Staden. So I believe that when we speak about enforcement of law, we should also consider important factors of law enforcement. Most of these smoke-free laws, they are not going to be, people are not going to be criminally charged. There is what we call FIC in the police stations, where people get a fine. For example, drinking in public is 150 rands, which is people are complying now. Not everybody goes around drinking on the street. It's only a few. And of course, there are always people who will break the law. So it is enforceable to ensure that we have a smoke-free environment, more especially on the indoor spaces. And also in terms of economic impact, because there's a question here about the jobs for small farmers and other things. I never said I don't care about the jobs of the industry, but I'm saying if we look at the structure of our country, you will realize that tobacco industry is actually contributing to only less than 1% of the employment in the agricultural sector. It actually contributes less than 1%. And when we talk about employment and unemployment addressing, we cannot talk about tobacco as a main source of employment creation, because we'll be shying away from the fact that the people where I come from still need that our country must be industrialized in government things that can and will be able to assist us in terms of creating employment. And also, not only that, we must understand the beneficiation of minerals. We need to ensure, that's why I'm saying some economic factors are going to be very much political and ideological, because it can't be that we're saying a government is out of ideas to create jobs and want to depend on a specific industry, because that would be giving it what we call an industrial supremacy, and at which we can't allow to be ruled by capitalism. So employment opportunities for young people, yes, we do want them, but the government, that's why I'm saying there's what we call whole government approach. Addressing employment cannot be seen to have been narrowed to one piece of industry that costs government a lot of money as well in terms of health. So we need to ensure that when we speak of employment, we consider that the public, more especially my constituents, has demanded that give them the land they are going to ensure that they liberate themselves. Take these monopolies and make them state-owned entities, and also nationalize the banks and all those. Those are my constituents. Those are the people in the township. They are thinking, because in my township, actually in many other townships, you'd be surprised if somebody knows somebody who works for the industry, and there are very few. So in terms of funding, let me say I cannot disclose because I am now representing a non-profit organization, but I am employed formally. I'm a level 7 employee of government, and also I would like to stress the fact that the Pheli Youth Conference Forum, it's a united youth formation. In other words, most youth-based organizations are part of Pheli Youth Conference Forum. Its programs are solemnly based on supporting the programs of other youth initiatives. And in terms of how I entered into the space of tobacco control, it is within my interest because I am concerned about the health of young people in our country. And as much as somebody is concerned, the health department has a health promotion team that goes around educating people about these matters. When we go to those workshops, we learn and we become interested in championing that cause, that call for a smoke-free generation. And without going any further, I would like to say that I am a proud member of the South African Tobacco Free Youth Forum. And I would like to say, if Dr. Leroux, you have extra savings that you want to donate to an organization, you are more than welcome to come to Pheli Youth Conference Forum and make your donation there. And there was a question about the nicotine intake and all that. You know, some things I think I can just say in common sense without going further into science, because then I do not want to play academia, whereas we are discussing a public health issue that needs attention of the parliament. My child must be first protected by the law before I can be able to protect my child. Because if there is no law that is protecting my child, I am not always with the child, and I cannot do helicopter parenting. There must first be the law. The government educate people. I will add to that education so that my child becomes safe. And let's say a nicotine is a scheduled drug. That one we know. If there are people who believe that, and also before going further, I want to address the issue that health reduction is, harm reduction is a public, yes, it's a public health term, and it has been used for quite a long time, maybe before I even existed. But the tobacco industry is manipulating that thing so that it can relate to public health. So tobacco industry has stolen that idea of harm reduction, and we don't have enough time. But I believe if the time is made available, I am available to also educate some who are concerned about how the industry stole that idea. So another issue is that when I say nicotine is a scheduled drug, unless it's in cigarettes, cannot be sold over the counter. It's a prescribed, it needs a prescription. So if the harm reduction people, or let me not abuse a holy word, harm reduction, if the industry, the vaping industry people want to have their product consumed as cessation products, then they know the correct channels. They know it must go through SAPRA and do clinical trials, and so that it can be proven, because we have nicotine replacement therapy that is available and it's effective, because it would be undermining years and years of hard work in trying to curb this smoking epidemic. So we need to actually be mindful of such. There's an issue about what is it that we can add to this bill. This bill is fine. This bill is fine, except for the fact that the nicotine pouches must be added there. This bill is fine, and it clearly stipulates distinguish between nicotine delivery system and cigarettes. But there are people who say this cannot be like this. What should it be like? If they wish to draft their own, then they must let us know. But it cannot be allowed, because the public has made demand that these products must be regulated. There are studies that have shown that 60% of the public believe these products must be regulated. And I'm going to also, in the terms of implementation, they said implementation of this bill into law is going to be difficult, and the law that came, the 1993 Act as amended in 2008, I think we will be discrediting a hard-working mother, Nkosazana Dlamini Zuma, who fought tooth and nail to ensure that laws are implemented, tobacco control laws are implemented. Will be undermining her hard work, because ever since these products stopped being advertised, there are researches that are there, and scientists in South Africa believe that those laws were effective. Remember, the smoking prevalence started rising after the introduction of hookah pipes and these things called vapes. You must remember something very important. We all said that these vapes cost at around 100 rands. If a child has 100 rand and they buy that thing consistently and then they start being addicted to nicotine, what is the nearest substitution for that thing? It is obviously a cigarette. So I think we must come back to reality to say that we must stop thinking of profits and think of health benefits that this bill is bringing to the table. And also would like to say that the bill is sufficient, Chair. It's sufficient in encouraging young people to stop smoking. Graphic health warnings are a consistent awareness in someone's pocket, and it motivates a smoker. I have made it a simple thing. Last time I was in Northern Cape, I had these packs of cigarettes from Ethiopia that I had, and then I had a local one. And then I asked people to choose between the two. They said they choose the local one. I said, why? And said, this one looks dangerous. So that is how effective graphic health warnings are, Chairman. So I thought you wanted to say something. If I'm consuming time, I believe I can still write to the committee in response to a lot of questions that are interesting, Chairman. Thank you very much.
Yeah, please do write. Among other things that you will write to us will be this thing? Helicopter parenting. You'll also write to us about the third-hand smoking and many others that you have not touched. Thank you very much. We'll then release you, but you can stay behind to enjoy the last presentation. Thank you very much. Ms. Machalamba, who is next to present to us? Okay, Ms. Machalasa, can we have the third presenter? I mean the last fourth, the fourth one. Okay, you can take your camera off, Patrol. Okay, let's get the fourth presentation, which should be the last for the day.
It's Tobacco Free Youth Forum.
Okay.
I've granted them the co-hosting rights already.
Thank you very much. Let the young people start. Okay, there you are.
Thank you so much, Chair. Just to confirm if you can see my screen.
Yeah, just go there and put the hourglass and you change it to a slide presentation. There you are, press there. Yeah, yes, go ahead.
Awesome. Thank you so much. Good evening to the members of the Portfolio Committee on Health, as well as other colleagues that are joining. I'm not sure if I'm audible.
Yes, go ahead then.
Okay, thank you. Unfortunately, I'm not going to be able to have my camera on for this section because I am using my laptop and the camera is it's facing some challenges. However, during the Q&A, I shall move to my other device, which I'm logged on to, so I can have my camera on. Apologies for that. I'm trying to... Okay, perfect. Sorry about that. So just an introduction. My name is Lesego Mateme, and I'm the project coordinator for the South African Tobacco Free Youth Forum. Just an organizational overview. We are a youth-led, youth-facing organization that is aimed at ensuring that young people know the harms about tobacco, the harms of tobacco and nicotine products, but also that we pull in young people into policy-making conversations such as these ones. Because again, I think as it has already been consistently mentioned, these bills will be affecting the life or rather our future. So it's important that we chip in and play a role in crafting them. We are a daughter organization to what is called the Green Youth Network, which is essentially a registered NPO which has over a decade of experience in basically advancing youth interest in the green economy, ensuring that young people, play a role in fighting climate change and also just advancing the sustainability agenda. So the Green Youth Network over the years has amassed over 10,000 youth leaders who are amplifying their role in advancing South Africa's just transition. While the South African Tobacco Free Youth Forum, we call ourselves SET5 for short. While SET5 is only 4 years old, it was essentially born from the realization that there is a gap for a strong youth movement when it comes to tobacco control. And also, of course, realizing that young people are disproportionately affected by tobacco and nicotine products. However, their voices in these conversations were usually not captured. So what we do as the South African the South African Tobacco Free Youth Forum, our core mandate is to essentially educate, inform, and influence change. We do this through information think tank sessions. We do this through webinars and bizos as well as media advocacy events, amongst other things. This is our organizational footprint. We have 5 chapters within 4 provinces, 2 chapters in Gauteng, 1 in Tshwane, as well as another one in Johannesburg. There's a chapter in Limpopo that is housed in Polokwane, a chapter in KZN that is in Durban, as well as a chapter in the Western Cape that is based in Cape Town. And for transparency's sake, we are funded by the Campaign for Tobacco Free Kids. A majority of our public awareness and advocacy efforts have been funded by CTFK. So to get into the conversation, I'd like to just bring our attention to essentially the South Africa's reality when it comes to tobacco products, a grim reality rather. Starting off with what we found from what was exposed by the Global Adult Tobacco Survey from South Africa that was released in 2021. It found that 29% of South Africans use some kind of tobacco product, and 25.8 of them are between the ages of 15 and 24, so very young kids. And then in 2011, which is a bit later, earlier the Global Youth Tobacco Survey reported that 21.5% of young people were currently using a tobacco product. This was in 2011, and these were young people between 13 and 15 years old. Additionally, when it comes to e-cigarettes, prevalence has increased between 2010 and 2021 by 920%, which is actually interesting mathematics. So continuing again on South African realities, according again to Get SA, 2.2% of South Africans use e-cigarettes, and again 3.1% of them are between the ages of 15 and 24. And again, it has been found by a university study that was conducted by the South African Medical Research Council, that in the university setting, under 1 in 4 undergraduate students reported using e-cigarettes or vapes. The study included 2,211 students from 15 universities in South Africa. The study findings also revealed that current prevalence of e-cigarette use amongst university students to be 26.3%. Just also closing it, or rather rounding it up, looking at, we looked at university. I'm now looking at high school. There's a study that has been, I think heavily cited by some of the presentations that came before me, that was conducted this year by the University of Cape Town, which included 25,000 learners from 52 schools across 8 provinces. I think Northwest was one of the provinces that was not included. This study has found that amongst high school learners, 36.7% of them reported ever using a vape, while 16.8% of them reported current use of a vape, and then 47% of them reported vaping within the first hour of waking up, suggesting high nicotine addiction. So given these statistics, it's important to note that they are not a mistake, nor are they a coincidence. In fact, the various trends that we see in how these products are taken up by young people has been engineered by a tobacco industry years ago. And it is quite upsetting and concerning that, we're still seeing these tactics that they've crafted still into play. So here are a few quotes from that have been extracted from tobacco industry documents from over the years. I'll just read a few. One on the left-hand side is from, an engagement between PMI researchers, and it was from a 1975 report, more than 5 decades ago. It reads that Marlboro's phenomenal growth rate in the past has been attributable in large part to our high market penetration among young smokers, 15 to 19 years old. My own data, which includes younger teenagers, shows even higher Marlboro market penetration among 15 to 17 years old. There's another one just right at the bottom that says it's a well-known fact that teenagers like sweet products. Honey might be considered. This is from conversations within, members of the tobacco industry again. There's another one also that is just at the top right, if I can, and it says that I have just received data on the graduating class of 1982, and the results are much more encouraging and corroborate the ROPA data. This is a survey that tracks smoking trends, and then these data show that smoking prevalence among these 18-year-old high school seniors has increased between 1981 as well as 1982. And the last one, it says, our attached recommendation to expand nationally the successfully tested Meet the Turk ad campaign and new Marlboro type blend is another step to meet our marketing objective, which is to increase our young adult franchise. To ensure increased and longer term growth for Camel Filter, the brand must increase its share penetration among the 14 to 24 age group, which have a new set of more liberal values and which represent tomorrow's cigarette business. It is why, as mentioned, honorable members, it's quite interesting that 5 decades later, these tactics are still at play and young people are still disproportionately affected by these products. Some are still being continuously targeted and some of them have already been targeted and have begun their journey to nicotine addiction. SET5 has been part of these virtual hearings together with the community-based hearings that just concluded recently in March this year. And one thing that we've realized is that, the voices and experiences of young people need to be underscored in these conversations, which is why we're so grateful to be able to be given an opportunity to be in this platform. And again, it's important because this bill, the decisions that are going to be made by this committee that is, convening us today are going to be affecting the lives that we lead and the lives that our children lead in the next decades. So it's important that we play a role in contributing to how these, pan out. With that being said, on behalf of the South African Tobacco Free Youth Forum, thank you again for the opportunity. And it goes without saying that we fully support this bill. Our presentation will focus on the 5 key tenets, amongst others, that are proposed by this bill and why these are important in curbing youth initiation, particularly, and addiction to tobacco and nicotine products, but also how they will contribute to assisting those who do wish to quit smoking. The first element that I'd like to focus on is plain packaging and graphic health warnings. I won't spend a lot of time here because a lot of my colleagues have already expounded on it. However, the research has consistently shown that, the packaging of these products adds to their appeal and how young people find them interesting. The color, particularly, as well as the design, play a great role in how the risk of these products are perceived, as well as what is called the sensory experience, especially again amongst young people and young adults. And what is most important, WHO has found, and also other studies, that the regulation of the appearance of these products play a great role, a vital role in reducing cigarette appeal and abuse, and again, may encourage cessation to those who hope to do so. In terms of countries that have already adopted plain packaging, there's a few of them, Mauritius being one of them, India, Chad, Cameroon, as well as Senegal. And with Canada, going as far as adding text on single stick, cigarettes as opposed to just a cigarette pack. And currently in South Africa, we do have, health warnings, but then as the cigarette package on the side, on the right, indicates, these are just only in text, and then they only occupy just a small space of the pack, allowing the brand identity and the colors and the vibrant, packaging to, steal the show. And also, again, not fully highlighting the gravity of these products. And again, the fact that these are in text, do also, how do I place this? They do go against, or rather, they don't consider the fact that we do in South Africa, we do deal with high rates of illiteracy, and then it's important for some people to be able to see what is meant when we say, for example, tobacco is addictive, or rather, tobacco causes cancer. But of course, particularly for young people who may also what's it called? They may also be able to relate more with pictures than with words. So I think the next slide will be of interest to you, Chair. It speaks to 100% smoke-free indoor areas. This is one of the main reasons why we support the bill, and the reason for this, for our support for this tenet of the bill is quite simple, and has already again been heavily spoken on, is the fact that there's no safe level when it comes to exposure of secondhand smoke. Even brief exposure has been found to cause immediate harms. The harms of these products, or rather of secondhand smoke, spans coronary heart diseases, triggering things such as strokes, lung cancers, as well as adverse reproductive health defects in women. So studies have consistently reported that adults who do not smoke and are exposed to secondhand exposure, or rather, yes, in adults who don't smoke but then were exposed to second-hand smoke, 2 million 2.5 million of them, have died prematurely since 1965. Exposure to secondhand smoke within adults that do not smoke increased risk of developing lung cancer by 20 to 30%. And again, these studies have found that in adults who do not smoke, exposure to secondhand smoke can damage the body cells in ways that set the cancer process in motion. And what is most also interesting is that it doesn't only end at secondhand smoke. As the previous speaker, my colleague, has alluded to third-hand smoke. This essentially is toxic residue that sticks to surfaces and dust long after the smoke has been cleared. This then takes us to the conversations about smoking in cars, smoking indoors, and smoking in restaurants, whether or not ventilation is enough or is sufficient. Because what we know about third-hand smoke is that it again, it sticks to surfaces, it sticks to clothing, carpets, and it builds up. So it can be you can open the windows to your car, open the aircon in your house, and then think that the smoke is out, but then those particles linger and they stick on clothes and surfaces and toys if you have kids, and meaning that these kids, infants and toddlers who are still crawling, and then they are interested in interacting with everything that they see, end up being exposed to this third-hand smoke that again can increase risk of cancer, damage cells, and then have other adverse health impacts. So it's important that this measure, especially of 100 smoke-free areas, indoors rather, it's important that it is put to place. This is what we support mostly. Again, what I've just shared exists under the background that in South Africa, 11.2% of South Africans are exposed to secondhand smoke at work, 18% of them at home, and then again, as alluded, there aren't any ventilation systems that are able to fully clear out, or rather fully ensure that smoking that is in smoking areas does not seep into smoking free zones. There are other countries that have introduced 100% smoke free indoor areas. These include Uganda, Ethiopia, as well as Mauritius. And when it comes to restaurants particularly, because I think a lot of restaurant workers have to be exposed to these places, smoke free zones, and also equally so the people who are there to enjoy their food at restaurants at smoke free zones end up being exposed to this smoke-free, end up being exposed to smoke from smoke-free areas. It's important that these restaurants, or rather, it's important that we do have, smoke-free indoor areas. And in a study that was conducted in 2018 by, the University of Cape Town, that sampled 750 restaurants, it was actually found that a majority of restaurant owners and managers support a complete ban on smoking in restaurants completely. Sorry about that. The study noted, a number of restaurants had already started voluntarily, instituting a complete ban on smoking, regardless of the current regulations of smoking in South Africa. And 45% of the restaurants had actually had no smoking, areas at all within them. Therefore, given these findings, as well as our understanding of how involuntary smoking, smoke rather travels, it's important that this measure is, measures are placed to support the non-smoker particularly, because it is quite, it would be quite unfair and unjust for a person who has actively chosen to protect their health and to not smoke to bear the same consequences as the person who chose, to smoke. So that's why we also champion 100% smoke-free indoor areas as well as certain areas. Another element of the bill that we welcome as set 5 is a ban on the sale of tobacco and nicotine products in vending machines. Of course, this is mostly because they're not regulated, but additionally, the glass interface of these vending machines serve as a way of advertising. And there are some vending machines that do not have a glass interface, but what they usually do is have pictures of the products that they sell, which again constitutes advertising. So most importantly, though, is that the ban of vending machines that dispense these tobacco and nicotine products, especially in nightlife spaces. This is quite important. Nightlife spaces, we're talking about clubs. It's quite important in South Africa, where we know that a lot of young people do indulge in the nightlife and enjoy are going to these places. It's important that these vending machines are not there, mostly because studies have shown that a banning of these vending machines, particularly at these nightlife spaces, reduces initiation among young adults who are not smokers, but also assists those who have a social smoker identity, essentially those who only smoke in social situations. Countries that have implemented, others, the ban on sales include Togo as well as the UK and Australia. So the next important element of the bill that we fully support is a ban on point of sale advertising. And the main purpose or rationale behind this is, of course, reducing overexposure and normalization of these products among young people. So this overexposure as well as normalization has been linked by a lot of studies to initiation as well as young people initiating essentially, because again, as I've said there, as I've indicated there at the top, overexposure leads to curiosity, and usually when young people are curious, they lead to experimentation. It leads to experimentation, and unfortunately, when it comes to things that are as addictive as tobacco and nicotine products, experimentation often leads to a lifelong addiction to these products. But one thing that is most important is that point of sale advertising adds to
You have a last minute.
Pardon?
You have 1 more minute to go.
1 more minute.
Yes.
Okay, so I will then, I think, just to conclude on point of sale advertising, this is quite important because again, overexposure to young people. There's a study that we conducted as the South African Tobacco Free Youth Forum, which essentially, it was an observational study that looked at how young people, how tobacco products are marketed to young people within a 300-meter radius. So from schools, high schools and primary schools. And the findings showed, advertising tactics such as, illuminated displays. 60% of these point of sales sold tobacco and nicotine products at the eye level of a child and near suites. And then these are sort of like ways of advertising add on to how young people perceive these products and also triggering initiation. Since I'm on my last minute, I will browse through a majority of these. And essentially, the main conclusion is that we feel as the South African Tobacco Free Youth Forum that, the rights of the smoker have been most of the time prioritized over that of the non-smoker. So it's important that this is corrected and balanced, and we believe that this bill will do so. Young people continue to be disproportionately affected by tobacco and nicotine products, be it secondhand smoking or, exposure to these products. So the tobacco control bill, especially through, measures such as, of course, the regulating of e-cigarettes, which are products that are now in the hands of young people. It's important that, or rather, we believe that this bill will ensure that young people are protected, and it also will contribute to creating an environment that allows smokers who want to quit to be able to do so. Thank you.
Honorable members, may I request that while I attend to this other urgent matter here, Ms. Shabangu takes your hands, Honorable Shabangu. I will also be included. I want to come last. Please include me, Honorable Shabangu. If honorable members can raise their hands, I will not be able to take them now so that I could just finish off with this in the next 7 minutes. Thank you very much. Over to you, Ms. Shabangu.
Thank you, Chair. Honorable members, I'll take hands as they come. The first will be Honorable Naledi. The second will be Honorable Van Staden. The third is Honorable Dr. Leroux. After Dr. Leroux is, I think, is Honorable Mtubatse with the iPhone. Then Dr. Lehlape will follow Honorable Dr. Lehlape. After Dr. Lehlape is Honorable J. Kumalo. Lehlape, Honorable Kumalo. After Kumalo is Honorable Marais. After Marais, Honorable Marais will be followed by Honorable Zungula. Then followed by Honorable Sene. Oh, so many hands. Yes, that is Honorable Mhlongo. The hand is not up. Zungula, then followed by Sene. Then Honorable Mhlongo will follow. I don't see any other hand. I know the other one is Honorable Kaiko. Is that Honorable Kaiko?
Yes, yes, Chair.
Okay, then you'll be following Honorable Mhlongo, then Chair will be the last. So I think you must just say, I will mention the honorables, not by numbers because they confuse. It's Honorable Naledi, followed by Honorable Staden, followed by Honorable Dr. Leroux, followed by Honorable Mutubati, followed by Honorable Kumalo. Honorable members, please keep your hands up. Why did you take them down now? Okay. Then after Honorable Mtubatsi Mtubatsi will be followed by Honorable Lehlape. Then after Honorable Lehlape is Honorable Kumalo, followed by Honorable Mare, followed by Honorable Zungula, then Honorable Sene, Honorable Mhlongo, then Honorable Peko. In that order, honorable members. You can start, Honorable Chiro.
Hello. I think the presentation was quite clear on its position in relation to the bill. I just want to find out from the presenters if they think or they believe that this bill is sufficient to discourage young people in particular. Like, does it have enough tenets, not only in the forms of implementation, but to discourage through socialization as the education process goes on, if it's sufficient in its current form to discourage young people from participating in tobacco and like products. And then secondly, I want to find out from them that what would they recommend as programs of action in the case of education and prevention that is targeted at young people, what would they recommend the department should partake in? For instance, I'll give an example. If you are saying radio, then your demographic is no longer young people on the issue of prevention and education. Just looking at statistics, but if we're talking about podcasts, then it's a different direction. So I just want to find out from presenters, what would they recommend as prevention and education programs of action should be taken on by the department in relation to this bill? I thank you.
Thank you, Chair, and thank you, Mr. Mateme, for your presentation. Just two questions from my side. You were talking about the plain packaging, and you showed us a slide of the countries that has introduced the plain packaging. My question on that is, did those countries stop, the people in those countries stop smoking in large numbers, or did the numbers of smokers remain constant when plain packaging was introduced? And then please help me with this. I've been asking this for everyone who was before this committee, and no one can help us. We as a committee looking for any scientific evidence on that can support your views on this matter, and I hope you can supply to us. So my question is, do you have any scientific evidence that can support your views on this matter? Thank you, Chair.
Thank you, Chair. Thank you very much for the presenter and for the presentation. And I think all of us are concerned about the impact of tobacco products and nicotine products on children. So I think it is a very important topic, and we appreciate your engagement with it. I think that I just wanted to, and I wanted to also just thank you for the point made around vending machines in nightclubs as a way to prevent young people from in that atmosphere from starting, and that's one that I haven't heard before, and I appreciate that point that you've made. I just wanted to raise one issue, which you and again, it's about funding. Our previous presenter wouldn't tell us who funded him. You have said, I want to be open about the funding, but you've mentioned the campaign for tobacco-free kids, which of course is an NGO that is funded. It's very easy to find, look it up online by Bloomberg Philanthropies and by the Bill and Melinda Gates Foundation. Now, that are both, American billionaires. And so I think it's really important that you do actually, I would like to understand why you didn't say that. Why did you use the cover of that? I mean, I think that Melinda and Bill Gates Foundation has done amazing work, particularly in HIV. So it's not, I don't think it's anything to be ashamed about, but because you hide it, it worries me. And so I think I'd urge you next time to be more open about it. The second thing I just wanted to say, I've heard a lot of presenters say that tobacco packaging and plain packaging and the display signs are going to make a big difference, and I'd really like to get a sense. So there's been arguments made that it's going to impact jobs, it's going to impact. We've heard poor people from communities who sell cigarettes at stalls in informal settlements say that this is going to dramatically impact their effect, and it's something that's imposed from other countries. And so I just wanted to get a sense of, you have evidence of what the impact of those things are compared to other things, like making sure that we tax things correctly and that we stop the illegal tobacco trade. Thank you very much.
Sorry, Honorable Mtubatse. Honorable members, my apology. I'm in the dark, as you can see here. It's that time of the day. But as we were requested, I would plead to members that are able to show their videos to do so, as we were requested by the chairperson. I'm in the dark. That is why I felt that I would not be able to show my video. But if starting from Honorable Mtubatse, thank you for the honorables that were showing their videos. If we can do that, please, honorable members, you can come in, Honorable Mtubatse.
No, thanks, Chair. My apology. I won't be able to show my camera. I'm in a very bad space, as you can hear in the background. Just quick on two questions. What is your view on online trading, selling, and what can be done? Because obviously, young people, everyone will have access to buying cigarettes if it's online, or maybe in other people who might move into this direction. What is your view, and what do you think should be done or can be done? We have many regulations, but everyone has spoken that our problem in South Africa is implementation. What do you think should be done, especially at the local level? Do you think that local municipalities must come with bylaws that will assist national legislation to be implemented? Thank you.
I would presume maybe I'm next. Chair, my questions would be, am I next? Honorable?
Yes, yes.
Okay. My question is, there's a lot that you spoke about in terms of smoke and contamination and third-hand smoke. There are products that don't produce any aerosol, like snus, like nicotine pouches. Why should they be treated the same as products that produce aerosols? The second issue is that, and I'm asking this because you're funded by US-based organizations that fund tobacco-free kids out there that have been even more vociferous about youth protection. But in that country, their regulator has found and looked at scientific evidence and is differentiating between the different products. The FDA is approving vapes and is allowing them to talk about being less harmful and public benefit based on science. Snus has been registered and been allowed to claim a public health benefit. Heat-not-burn product called Rycos has been allowed to be registered and to be able to claim based on science reduced exposure. So what is, given the base where your funding comes from, where your base organization is active, and what the regulator has come up with based on science, what is the opinion of the South African chapter on differentiation of different products and different regulations? So that we can get into that debate where it's science-based regulation with risk proportionate regulation according to the harm caused by a product based on science. Those are the only two questions that I have for now, Chair. And lastly, Chair,
Honorable
in the
Khumalo,
US,
please come in.
just one last thing. In the US, they found that with all these introductions and re-education, youth vaping has come down, but youth use of cigarettes has dramatically come down. And the overall nicotine use amongst youth is trending in the right direction.
Thank you, Chairperson. Chairperson, let me take this opportunity. Do you hear me, Chair?
Yes, Khumalo, you can continue.
Thank you very much. I want just to appreciate the presentation, Chairperson, from the presenter. I'm just having only one question. It is as follows. Should this bill be passed, what do you see as the role of your organization? And how can other young people partake in this process? What should be the youth needs from government? What would be the youth needs from government after this bill has been passed? Thank you, Chair.
Honorable Mare, please come in. Honorable Zungula, please, if you just come in, Mara is not available, we'll jump in.
Thank you, Chair. Unfortunately, I'm also in the dark. I won't be able to show my video. Perhaps as a comment, it's pretty interesting how today all of the presenters seem to have some form of similarities in terms of their presentations. It does give an impression that there has been some working together behind the scenes to align these presentations. But when I come to the presentation, I've got a couple of questions. The first, with the organization being funded by Americans, I would want to understand from the presenter as a young person as to what is his sense of policy formulation in South Africa must be informed by the needs of South Africans, and it must be the best interest of South Africans, and without undue influence from foreign agencies and countries. And then the second question would be the issue of harm reduction. Does the presenter agree with the sentiment to say, in light of what we have in our country, we perhaps need to have a strategy that is gearing towards harm reduction to ensure that the people's rights as protected by the Constitution are protected as well. And then the last issue, it is the issue of illicit trade, whereby given how we saw in 2020 during that lockdown period, how there was a big spike in terms of illicit trade because of the ban on tobacco sales at the time. Does the presenter maybe, what is the view of the presenter on the question of we may do one thing, which is maybe have regulations that are very stringent, but the outcome of those regulations would make the problem much more worse given the high prevalence of illicit trade in South Africa. Thank you, Chair.
Thank you very
Honorable
much.
Pheli.
Thank you very
Thank
much, Chairperson. Let me just show my video. I'm not a robot, but allow me to switch it off, Chair. Thank you. The industry manipulation and targeting of the youth to use these products is very much concerning. So, South African Tobacco Free Youth Forum, can you please tell us in the context of, in the South African context, do you think that these gender variations apply in terms of manipulation and also targeting of the youth? Thanks, Chair.
Thanks, Chair. Thank you for what has been presented to us by the presenter. I've got some few questions. Tobacco Free Youth Forum as an organization on Tobacco Free Youth Forum, do you have evidence-based information pertaining to your caption that might yield positive results? Secondly, are there any criticism or controversies, if any, that pertains to the South African Tobacco Free Youth Forum? Are there some possibilities to render our youth tobacco free after indulging and testing? Looking at the fact that initially the very same tobacco or cigarette that we are talking about today has some problems for us as South Africans, but initially these were promotional, or rather they were promoted with some promotional songs like New York, ukwayo madoda, ukwayo penyonga madoda onke. Look at where we are today with problems and diseases. What is your take to the fact that tobacco and drug abuse is stealing our youth future? Vaping hits alarming levels amongst our teenagers as to the statistics that has been given to us by the very same presenter initially. Thank you.
Thank you very much, Chairperson. I think it's my turn now. Chairperson, in appreciating the presentation, I am tempted to say these presentations today were supposed to be done in June during the Youth Month, because the young people today are planning their future. We can say there's uniformity in presentation, but it's good that there are different presenters. There has been uniformity around the issue of illicit trading by previous presenters, and uniformity around harm reduction. Now the uniformity is around the support and the commitment by young people to support what they think will protect the future leaders of this country. Thank you very much to the presenter. What I also wanted to ask is that I believe and heard that the presenter, they are against the addiction and to nicotine. They are against that. But my question would be, do they think this bill addresses that adequately? He has confirmed that they are strongly against that as young people, but is what is highlighted in the bill addressing that concern adequately? Also, Chair, my question would be also around vending machines. Is it enough what we are saying in the bill in its current form, that we totally suggest banning of these vending machines? That's what I wanted to ask, Chair, from the presenter. Thank you very much.
Okay, thank you, honorable members. Before the chair comes back, while the presenter is getting ready to respond to the questions and comments, I just want to take you back to the regulation of nicotine products. And from the previous presentation, we've heard this word oral nicotine for almost all of them. Can you provide us with the different categories of other types of all types of nicotine or nicotine products that are containing nicotine? Types of nicotine products and any other thing that contains nicotine, if you can provide us with that information. And also inform us, where does this nicotine comes from? Is it something that can be produced, or it comes from something? I would like you to maybe give us an information on that. While you preparing to respond to us, let me check if the chairperson is back.
Yes.
Chair,
Thank you
are you
very much.
back? Thank you,
Yes,
Chair.
thank you.
You can come in.
Yeah, I wanted to add on what. Thank you very much for holding the fort while I was handling this other emergency. I wanted to check with the presenter if there could be this presentation actually is strong on what they don't want to see as young people. Its bill is strong on issues related to that, but how do we also support or strengthen the bill to deal with the adults and people who are already there, and people who are on this program but are not able to really completely get out of it, meaning that the quitting is probably not that very possible, but you still want to really encourage them to be moving away from cancer of the lungs, secondhand smoking for me and you, what would you be advocating for? Two, this committee will still have to decide on what flavors, if we have, that are going to be supporting vapes. But what would be your view in terms of advocating for? I've seen your pictures. You say the sweets are next to the vapes, and there's sometimes when you buy these vapes, they give you a can of something else or sweets. All those attractive things that are not good. So, but would you have an idea or a view in terms of if there were to be vapes allowed? One, how wide should we go in terms of having certain flavors allowed? Two, in those vapes, there has been a view that maybe the easy access of vapes is because there's a single use, young people. Rather, if you want to regulate, keep those that are multiple use, a bit more expensive, so that the young people can not easily access. Because also these single use, they have an impact on the environment that is huge. There was one presenter that educated us about that. So if you could then give us responses, maybe we'll really ask you to take now 5 past, 6 past, so not beyond the 20 past 7. Thank you very much. Responses?
Sorry about that. Thank you so much, Chair, and thank you so much to the honorable members for the questions. I will try to answer them in order of how I received them, but I might end up going here and there because some of them do share some similarities. So I think starting off with the question that was asked by Honorable Naledi Chirompungose on whether the bill is sufficient in discouraging young people in its current form. We believe that it is. The
Sorry,
measures
sir.
that we
Sorry, sir. I think
sorry.
the speaker's a bit soft. Can you speak up a bit?
Am I better now?
Yeah, raise from your side, honorable member, also because we can look at the gadgets and see if we can raise on your side too.
Okay. Thank you so much. Yes. So on the question raised by Honorable Naledi, we do believe that it is sufficient in discouraging young people in its current from participating or even essentially initiating. A majority of the elements of the bill that we did cover on our presentation are grounded in evidence, as well as other countries having implemented them and seeing reductions in youth initiation. In terms of recommendation on education, there was a question on, how to recommend to make sure that we do reach young people on public awareness. I think this is quite important because, of course, in terms of information and raising awareness on the ground, you are bound to miss a few young people. So social media is one of the most important platforms, and then that we can look into using or leveraging when it comes to raising awareness on this particular issue. But then again, I think there's a conversation that has also been had about ensuring that these products, or rather the harms of these products, are also integrated in some of the curriculum for subjects such as LO, because like I was in high school a while ago, but then the last time I checked, the main thing that you would hear was that smoking causes cancer. But then again, it didn't expand more on these products and the harms that they would have on your health. I think on there was a question that was asked by or posed by Honorable Van Staden about evidence on whether or not prevalence, or rather plain packaging, led to a decline in rates of smoking. And there's actually quite a few studies that exist regarding plain packaging and the effects that it has had in decreasing smoking rates. I am more than happy to share these with you. And I think the next question also on was by Honorable Leroux, and then it was basically regarding CTFK being our funder. So it was never the intention for us to be hiding, because again, we are funded directly by CTFK. So in terms of who funds CTFK, this does not mean that we are hiding or trying to protect anybody, but then the main person who funds us, the person who directly receives funds from, is CTFK. And regarding, I think you asked a question about plain packaging, as well as the impact on jobs, taxing, and I believe illicit trade as well. The plain packaging, or rather standardized packaging, does not say that there's just going to be nothing on the cigarette packs. There's also other things that are going to be considered, like markers that will show, or text markers, I believe, that will show that that'll ensure that this product, or rather that'll show that this product is not an illicit product. And I think there were questions about a view on I think there were quite a few questions that were posed by Honorable Motoba. I said that I kind of missed a bit because of, I think I was not receiving the network was not that good on my end, maybe, but I believe, if I'm not mistaken, the question was on my view on, or our view as an organization, on online sales regarding of these products. And I hope I'm not misquoting you or misinterpreting you, but then I think when you look at products such as e-cigarettes, the fact that they are currently not regulated is the reason why we can find them on your Uber Eats, your grocery apps such as Pick and Pay ASAP, right? If you do go to Uber Eats perhaps, or even your Pick and Pay ASAP, and then you search vape, you'll be able to see these products and you'll be able to purchase them. However, if you go on the same platforms and then you type in cigarettes, you will not be able to see them. And this is quite concerning, mostly because the fact that these products are here while cigarettes are not continues to sort of like the normalization of these e-cigarettes, but also the misinterpretation, not misinterpretation, but then us sort of like the industry portraying these products as having no harm, because I think that's what they're usually that's what is happening on these platforms. The fact that cigarettes are not there but these products are here, it means that we're trying to create that association that they do not have any harm. Not paying attention the fact that a lot of young people do use these services as well. And yeah, so I think when it comes to online sales, regulating e-cigarettes would assist in ensuring that they do not just have widespread a play, or rather the horizon is not as limitless when it comes to them selling as well as them advertising. And I think there were a few questions that were asked by Honorable Letlape on whether or not these products that do not contain aerosols should be treated the same way as those that do not contain aerosols. I'm sure this was in what's it called? This was regarding oral nicotine pouches. Essentially, when it comes to nicotine products, particularly if we're looking at vapes as well as products such as oral nicotine pouches, they do have high levels of nicotine within them. They do have, they are linked with nicotine addiction, particularly amongst young people, and in the same breath, they are marketed to young kids. So the main thing that we are advocating for is that, the bill sufficiently and adequately touches all nicotine products, because so that the main reason, so that of course there are other products such as vapes that are available. However, there's also in the future, there's also other products such as oral nicotine pouches and other products that may come up, because we know that invention when it comes to nicotine products is quite high. So it's important that we recommend rather that the bill is more comprehensive when it comes to nicotine products and does not only specify the mode of delivery. And regarding, I think Honorable Letlape did mention talk about the USA and how there might be a disconnect with what we are talking about and what is happening in South Africa. There is evidence that actually shows that even though the years in South Africa, the vapes rather have been in the market for close to 15 years, smoking has still been increasing, particularly amongst young people. So this bill is trying to make sure that these young people, we've seen that these products are new, and then we've seen that these products, young people have an appetite for them. How do we ensure that they do not initiate these products, ending up, being addicted to them? And I think when it comes to differentiating these products, the bill does do that. It does take account product differentiation. For example, Clause 4 does talk about standardized packaging, that it must be regulated in a certain way. And for nicotine products, it says may, which means it might not, even though that's something that we are advocating for. And I think if we go to I think there's a question that I might have missed. Oh yeah, there was a question from Honorable Zungula, if I am not mistaken, regarding I think foreign agents and their impact, or them influencing our policies in South Africa. And the main what I can say to that, or the position that we hold as Set 5, is that we take we are a South African organization, and then we work within South Africa with other South African young people to advance the cries of South Africans, or the realities rather of South Africans. And additional, I think to this question is that we do somehow feel like it's sort of like in a way, it might be undermining the work or the expertise that South African members have, the members that drafted this bill. Because I believe that this bill has went through rigorous consultation processes. We started with community-based public hearings, I think, in 2023, and then they only lapsed this year. And then this was a way in which the committee would make sure that it gets the views of South Africans on what they think about this bill and bring them along into the policy process. And then the bill was again still in was debated on from since 2018 or even before that. So that is essentially our stance on that. And again, there is I think there was a question on what's it called, a spiking on illicit trade. There is no evidence that stricter regulations or legislation will make illicit trade worse. What except that the committee we want to essentially sorry about that. I think, oh yeah, this was from Honorable Zungula. There's actually no evidence that illicit trade will be worse in terms of yeah, illicit trade will be worse due to this bill. The main thing that we are trying to highlight, essentially, especially as the forum, is that there is evidence that suggests, if we're looking particularly maybe at e-cigarettes, there's evidence that suggests that these products are addictive to them. And there is evidence that suggests that they do have adverse health impacts. So they need to be regulated so we don't get ourselves in a situation where we're taking them lightly, and then we deal with a situation that is similar to with cigarettes, where years to come, we realize that it has a lot of negative long-term harms on the on health. I think there was a question that came from Honorable I think it was Sin, regarding gender variations in how the tobacco industry targets youth. I think most of the time the main example that I can think of is that in a lot of marketing, if we're looking at e-cigarettes, for example, in a lot of marketing that they've been doing now, we do see increasingly that they do work with a lot of female influencers. There's another sort of like image and video that I had in my presentation that shows sort of like an influencer campaign that is funded by Views, that essentially talks about the different products, or rather the different features that the new products has, but also it uses a celebrity that has close to 1.8 million views and has a wide female as well as young audience. So these are some of the ways that we see them sort of like using particular people or influencers, particular audiences, to be able to gain to talk to or appeal to particular sort of like demographics. I think there was also a question by
Last minute.
oh, last minute. I think there was also a question by Honorable Shabangu on I think it was on oral nicotine pouches. And I think it was on providing on the different types of products that do exist, and also where the nicotine comes from. So there are quite a lot. There's of course vapes with which are nicotine products. There's oral nicotine pouches as well. But what we've also been seeing is there's products such as I think no, it's mostly oral nicotine pouches. And while we can't well, the bill does not essentially specify, nicotine pouches in the bill. We would propose that, the bill sort of like broadly regulates nicotine containing products, because this again will sort of like expand in terms of what is included in the bill. In terms of saying nicotine delivery products, we can then say nicotine, we can also include nicotine containing products, so that even they are also covered. I think I will stop there for now.
Yeah. Okay. Yeah. No, thank you very much. We want to thank all these young leaders who came into this platform. They were all, I'm sure the members will agree with me, they were all well prepared for what they were giving us. One just wants to comment their enthusiasm and their dynamism in preparing and understanding the topic that they want. We might actually not agree with all what they say, but they actually know their story and wanting to present what they would like us to know and consider. It's not and it's not usual. We find our young people so knowledgeable on a particular content of a subject. So we commend you. Go on in other programs that we are involved in to really mobilize young people on other issues that are really worrying us, social ills that are worrying us in our country. Thank you very much for this, and you may then relax and go. Honorable members, we need to agree to come back again at 3 o'clock on Tuesday. That will be the last part, one day before we conclude. I wish you well in the weekend, and thank you very much for your active participation. The meeting is now adjourned. Thank you.
Thank you, Chair. Good evening.
Bye, everyone. Bye, Chair.